We'll see if we can get Mr. Gallo on later. We will move on to agenda item 5A, discussion and possible action, including an update associated with the novel coronavirus, COVID-19, including possible direction regarding essential services in Mendocino County, including operational preparation and response, and an update on county continuity of operations and services. So the sponsor is the Executive Office. And we're going to have three speakers, Carmel Angelo, Dr. Duhan, and Deputy CEO Darcy Antle. Okay, so CEO Angelo.
Mr. Chair, this is Janelle Rao, Deputy CEO. Ms. Angelo had to step out and take a call from Senator McGuire. However, she is just entering back into the room. If you want to move on to perhaps to Dr. Duhan, if she is on the line, she could start.
Very good. Okay, Dr. Duhan.
Yes, can you hear me?
Yes, good morning.
Good morning, supervisors. Thank you for having me before you to give the opportunity to speak. You know, there's a great deal to say about COVID-19, and I could make a presentation that would be an hour in length, but I'm going to try and keep it to about 5 to 10 minutes, because we have a lot to do today. So I want to share that one of the concepts that we've talked about a lot here in Chambers is slowing the spread, flattening the curve, and giving us time to prepare in this COVID-19 pandemic. And I think we are realizing across the state of California that we've only delayed the curve. We have not flattened it, in fact. Sheltering in place, social distancing, the wearing of facial coverings has given us time to prevent the pandemic from breaking through into our entire county, but it has not made the pandemic go away. So in recent studies in the Bay Area, only 5% of the population in the Bay Area, which is the epicenter in Northern California of COVID-19, appears to have been infected. And therefore, we know that when we lift sheltering in place, we are going to have outbreaks of COVID-19. We realize that, and yet we know, health officers across California, as well as the governor, know that at some point we have to lift sheltering in place. And when that happens, we will have outbreaks. So what we've done is we've slowed the spread and given ourselves time to prepare. And that preparation has taken many forms. We've stood up our Emergency Operations Center. We have a DOC now, a Departmental Operations Center. We have done contact investigation, case investigation, contact tracing training for our staff. We have actually carried out with every single case we've had. We've carried out case investigation and contact tracing. We have increased our testing capacity. And we have increased our capacity to provide isolation and quarantine housing. We have done all these things. And with these efforts, we have created surge capacity. Our hospitals have created surge, our clinics have created surge, and we have become better prepared for COVID-19 to hit our county. If we had not had the time to prepare these resources, we would have been in a desperate situation here in Mendocino County. But given this time, we have been able to prepare some very, very important resources. We have been able to engage scientists from Imperial College in the United Kingdom, the same scientists that have been engaged by Sonoma County. And these scientists have modeled for Mendocino County based on our rural community, based on the numbers of people in our population and their age distribution. Imperial College has been able to model for us is that if we didn't have sheltering in place, social distancing, isolation and quarantine, and tracking of cases with increased testing capacity. In other words, we had no mitigation. If we did not have these things, we would get about 1,800 cases of COVID-19 in 2 months. So in other words, if we just opened up sheltering in place tomorrow without expanded testing capacity and out expanded resources, we'd have 1,800 cases in about 2 months. And based on other studies around the world, we'd have about 180 people hospitalized within a month and about 90 people needing critical care. And we would expect about half of those people needing critical care to die within a month, 45 people. This is an estimate of just what would happen within a surge in about a month after reopening, month to 2 months. We're not going to allow that to happen in Mendocino County. I'm not going to allow that as your health officer. And I'm sure that I'm speaking as well for Carmel Angelo, our incident commander. We're not going to allow this unmitigated surge to happen. So how we prevent that is by having limited reopening. And that has been the plan that I've had now in place for months, that we would have limited reopening. And that limited reopening is going to happen when my current sheltering in place order expires on May 10th. There will be a new sheltering in order ready to be released on May 10th. And that is going to include reflections of what the governor will allow. And it will also include reflections of what our region is doing in the other counties. And I will talk in a moment about my reflections about what I expect will be in place. But again, we're waiting for the governor because we can only be more restrictive, not less restrictive than the governor. So who I collaborate in my decision making is, of course, listening to the governor. Also, the Bay Area health officers, we call them the Central 7 and the Outer 6. The Outer 6 includes Sonoma, Marin, Lake, Solano, Napa. And the Central 7 are going to be releasing tomorrow what their plan is for limited reopening. The Central 7 have already said, these are the big counties in the middle of the Bay Area, that they will continue sheltering in place through the entire month of May, but it will be a limited reopening. I also collaborate very closely with an association we call Rancho, the Rural Association of Northern California Health Officers. These are the health officers that go from Mendocino up to Humboldt. And we communicate regularly and frequently about our plans for limited reopening. And we all want to be in alignment with one another as much as we can be. So given the fact that we believe that only 5% of the epicenter of COVID in Northern California has been actually infected by the virus, so 95% of people still don't have immunity. We don't have a vaccine. We don't have a treatment that is effective at this time. Limited reopening is going to be looking at not using the terms essential and non-essential businesses anymore, but looking at what is high risk and what is lower risk in terms of the activities that we will return to. And these activities not only include businesses, but they include our churches, our schools, and our parks, and the many different things that make our lives rich and healthy. So what we look at, all of the health officers and the governor as well, what we look at is a balance between social benefit, risk of transmission, and the ability to social distance when we're looking at what should be limited, what should have the limited reopening in the first phase. So limited reopening will be phased. The first phase will be only with the lower risk activities. The higher risk activities will wait, and we'll see if we get a surge. If we get a big surge by opening up some more of the lower risk activities, then we might have to go backwards into sheltering in place again. So none of us want that. We want to be successful with limited reopening. That's why it must be phased. And what I'm saying is in absolute alignment with the governor and all the health officers, the Bay Area all the way up to Humboldt. So what do I expect? And I'm going to tell you only what I can give you my expert opinion. I don't know what the governor is going to do. And again, we can only be more restrictive, not less. I don't know what the Bay Area Central 7 are going to do. And I will tell you the governor is very likely to follow the Central 7. That's why I follow the Central 7, because the governor appears to as well. So here's what I think. I think that in the next 3 months, there's not going to be an allowing of gatherings of any great size. If I had to guess, I would say no gatherings over the size of 18. That's a guess. I don't know. But I know that with the governor, there was a period where it was no gatherings greater than 10. And then it was none greater than 50. So I'm just going to guess no gatherings greater than 18. I'm also going to take an educated guess that we are going to say that those who are greater than 65, who have frail health or have frail health, should continue to shelter in place and be allowed to work from home if possible, if they are still working. I'm going to take an educated guess that children will be allowed to go back to school and be able to participate in camp and be able to participate in activities such as go to libraries to the extent possible, because we do want to see our children returning back to normal activities as much as possible. I'm also going to guess that parks are going to be open and golf courses, which has been a hot topic, will be allowed to be open. These types of recreational activities that are outdoors and that can have social distancing and limited transmission between individuals, I am going to guess will be open. I'm also going to take a guess that activities that can be done by a single worker that might be able to come to somebody's house, like gardening, house cleaning, maybe even hair cutting, could be done in people's homes. And that this might be a way that we can get these essential activities or these businesses back to work. I also believe that we'll have a restriction on tourism, and that this is very, very important to limit transmission. I think this is something that there's not a lot of controversy about in our county, that we need to limit transmission into our county from the outside, and that the only way to do that is to limit tourism. But at the same time, that leads us to questions about hotels and how can we keep our hotels open. And there are suggestions about having longer term stays and perhaps even people being able to quarantine for 14 days in the beginning of their stay. Anything that we do as we have limited reopening must continue to reinforce social distancing, facial coverings, having healthcare workers and first responders have medical masks, and there must be continued hand washing stations so we can have increased hygiene. All of these things must continue. And this will be more and more on employers and on the community members themselves to make sure that these are occurring. I think this is my guess again, I think it's unlikely that we're going to see opening in the next 3 months bars or wine tasting, theaters, indoor gymnasiums or indoor exercise studios because of the risk of transmission, the lack of ability to maintain social distancing, and the risk then of COVID-19 outbreaks. I'm very grateful that the supervisors have formed an ad hoc committee to work with West Company to help with how we craft the next sheltering in place order that will be released on May 10th that will frame limited reopening. I do want to say with regarding the governor's order, as we can only be more restrictive, not less, there have been some vague areas in the governor's order, and I followed the Bay Area in terms of making sure that my order was clear. And where there was vague areas in the governor's order, my current order was more restrictive, as a matter of fact, than the governor in some areas. There are summaries that are available that have been made by county council about how our current orders differ from the governor's in terms of being more restrictive that can be requested. If we did have an outbreak in a certain business type, I would expect that as we go into limited reopening, that business type would be then closed. So this is something I don't know, but I am anticipating that, let's say we allowed a certain business category that we thought was lower risk to open, and we saw outbreaks in that business category, it would put us in a position where we would have to look at that particular type of business being closed. So every time that I've come before you, I have talked about the need to have several elements in place before we can have limited reopening. One of those is the ability to have safe isolation and quarantine of cases are in isolation and contacts are in quarantine. These individuals need to have safe housing for this, and we need to have the capacity to follow these people, to monitor them with public health calls daily or frequently to make sure that they are still isolating and quarantining and they have the essential supplies that they need to do that. I've also talked with you about the need to have expanded testing. There has been a study from Harvard University about the amount of testing that is sufficient. And that study has suggested that we need 150 tests a day for every 100,000 people. That's 150 tests a day for 100,000 people. And the testing should be guided by contact investigation, or case investigation and contact tracing, meaning that when we find a case, we discuss with them who their contacts were, and we offer all of those people testing, whether they're symptomatic or asymptomatic, and that we also prioritize the testing of people who are out in the public. And as we get back to normal, that would include teachers, people in businesses that are open, that we would be able to do surveillance for our people who are working out in the public. So our goal would be 150 tests a day. We do not have anywhere near that capacity at this time. Our capacity is limited by a number of factors. One is the limitation of the supplies needed to actually collect the samples, the sample collection kits themselves. The other limitation is the ability to actually do the PCR test for the COVID virus, the SARS-CoV-2 virus, on those samples. And currently, that testing capacity is very limited. Through public health, we use the public health lab in Sonoma County, which is shared with Sonoma and Lake County. There are also hospital-based testing capacities here at Ukiah Hospital and Willits Hospital, but that is also limited capacity, about 60 tests a week at Ukiah and 70 tests a week at Howard Hospital. We're also delighted that the Round Valley Indian Health Center has an Abbott machine for actually doing COVID testing on the reservation. But that machine has limited capacity and only should be used on people that are symptomatic. At this time, that machine only has 48 tests remaining that can be done on the Round Valley Indian Reservation. So we are very limited in our testing capacity, and I can tell you that CEO Carmel Angelo, who's our incident commander, and I have been relentless, absolutely relentless in our advocacy to get more testing capacity for Mendocino County. We need it. We need it yesterday. We need it now. And I have been raising my voice, and I know that around the state, I have been heard, and Carmel Angelo has been heard, but there are many other counties that are raising their voices as well, because we're not alone in this crisis of not having enough testing. So to finish up, there's a lot more I could say. Of course, I could say a lot about our surveillance testing program that we've been doing around the county and how successful that's been. That has been shifted now to focusing on the outbreak that we have currently, which is taking the priority for us, as it should. That outbreak is on the Round Valley Indian Reservation, and we are incredibly grateful for the leadership of Chairman Russ, who leads both the Round Valley Indian Tribal Council as well as the Round Valley Indian Health Center. And he is a very strong leader, and he has asked for our help in containing this outbreak, and we are responding swiftly and with great strength in the capacities that we can within Mendocino County. So yesterday, a team with very short notice went out to Round Valley Indian Health Center with the support of the Tribal Council and the Health Center, and we did nearly 200 sample collections on contacts of the cases, the original 6 cases on the reservation. Also included in the testing were frontline workers. And so those tests we collected with our own team. We collected them with sample collection kits that were given to us by the Sonoma lab. And then we had to drive them at the end of the day all the way to the Sonoma lab and hand them off to the director, Rachel Reese, and they are being processed today and tomorrow. So that lab has limited capacity. I wish they could do the nearly 200 tests quickly, but it's going to take a couple days. When we get the results back, this is going to guide our next steps in terms of the response to the outbreak on the reservation. And Carmel Angelo can speak more to that. I am very concerned about this outbreak. For any of you that know about the outbreak in the Navajo nations, you will understand why I'm so concerned. It has been said that the outbreak on the Navajo Nation is the 3rd largest outbreak per capita in our country. The first is New York and the second is New Jersey. And there are multiple factors why an outbreak on a remote reservation can be so devastating. And I'm not going to go into those now, But I just want to say that the people of Round Valley, the people of Kovla are very precious to us. And we will do everything in our power to protect them and to respond to this outbreak. And we are very appreciative for the leaders of the Round Valley Indian Reservation and them allowing us to participate in this response. So I also want to say that we're very fortunate that the California Rural Indian Health Board, CRIB, and their EPI division, their epidemiology division, their California Tribal Epi Center are working alongside us to help respond to this outbreak, because this is a very complex case investigation and contact tracing, and we need help, and they have come right forward and are helping us with great expertise. We plan to do another 200 sample collections tomorrow at the Round Valley Reservation to continue our case investigation and contact tracing, and that is going to be our what we do as we wait for more resources to arrive from the state. So I think that can conclude my summary. I just want to end in saying that there are 3 million cases of COVID-19 in the world at this today. There's 1 million in the United States. A third of the cases are in the United States. We've hit over 56,000 deaths in the United States from COVID. When I first started following this pandemic early in January, the projection is that we would have over 2 million deaths in the United States from COVID. I fear we're heading in that direction. And so I'm very, very grateful to the people of Mendocino County, every person, whether you're an elected official, whether you're an elder staying at home, whether you're a frontline hospital worker, every one of us has contained this pandemic, so that we've only had 11 cases in our county at this time. And every one of these cases has been traced to travel outside the county. Every case has isolated. There is no evidence of community spread. Evidence of community spread would mean we wouldn't know where the case action came from. With every case, every 11, we know where it came from. It came from contact outside our county. So I believe we can continue to do an excellent job to protect our county, because I believe we will have limited reopening that is safe and is wise. And I am continuing to be here to serve you as I can as your health officer. Thank you. That's it for me today is my report.
Okay, thank you, Dr. Duhan. Right now, we're going to go to CEO Carmel Angelo.
Thank you, Chair Hashtag. I would just like to echo Dr. Duhan's words that we have spent considerable time working with Round Valley and Chairman Russ, and I think that honestly, Mendocino County has had an excellent response and partnership in working with Round Valley Health Center and the Tribal Council. 10 staff going to Round Valley yesterday and doing 160 tests is phenomenal for a county our size. So we are waiting to hear more. As Dr. Duhan said, we did learn late last night that our plans that were actually put on social media, that we would be moving forward with bringing in resources for isolation and quarantine, additional testing and contact tracing, and those resources were coming from the state. We learned last night somewhere between 7:30 and 8:30 that would not be happening. However, I did get multiple calls already this morning, and the state, like we are waiting for the test results to determine what their next steps will be. Nevertheless, Mendocino County is moving forward, doing the right thing, and providing as much testing as we can in a situation that could be a potential outbreak. So we will be doing additional testing tomorrow in Covelo as well. And then, of course, there are additional testing sites. Regarding the county services and OES update, I believe that Dr. Duhan did speak of this. We have a departmental operations center open now with Health and Human Services and Public Health, and they are gearing up, training more staff in response and also in public health activities to respond to C-19. We still have the support of Lieutenant Shannon Barney and Sheriff Kendall as far as the Emergency Operations Center being open. And we're still working collaboratively throughout the county system to provide support and response to the 90,000 people that you serve. As far as county services, we are waiting to hear more about what the governor's intentions are as far as the shelter-in-place orders. And along with Dr. Duhan, we still remain, most of our offices remain closed to foot traffic, and I would say that county services are provided and continue. And the department heads report out once a week as far as what's happening in their departments. I think that at this point, we are all waiting and hoping to be able to open our doors in the near future. I believe that is really my report for today. Thank you very much, Chair Haschak.
All right, thank you, CEO Angelo. And we're going to go to Deputy CEO Darcy Antle.
Morning, Chair Haschak and members of the board. Darcy Antle, Deputy CEO. Today I'd like to report out on the number of hours that we have worked on this pandemic. We are over 25,000 total hours for regular time and over 6,000 hours for OT, so overtime. I would like to point out that FEMA only reimburses 75% of our overtime. Straight time is not included or reimbursable. I would like to move on and talk about the 3 projects that we have filed with FEMA so far. As mentioned prior, we have received an obligation letter from FEMA for the EOC work for $750,000. That was close to $2 million project that we put forward. We do not have that payment. We are waiting payment, but we do have an obligation letter. So I want to make that clear. It's in different steps. The other project I would like to talk about is the non-congregate sheltering. This is the hotel motel work that Department of Health and Human Services is doing for the homeless. This was started out to be a 45-day project with an estimated cost of $300,000. At this point, that project is due to end on April 30th. We have put together talking points for CEO Angelo to work with Senator McGuire and Wood to extend this timeline. It is critical that we extend the timeline through the shelter-in-place order. At this point, we do have a written approval, not an obligation letter from FEMA, but written approval that this project is approved at this rate of $112,000. Again, at this point, they're only obligating 50% of the 75% allowable. I would like to also point out a contract that will be coming before you next week for the Community Foundation. This is some work that CEO Angelo and I have been doing with the Community Foundation, along with HHSA Director Tammy Moss-Chandler. I would like to read you a brief snippet out of this letter. Again, it will be attached to the item next week. Based on the current economic data from our county, it is possible that at least 55% of Mendocino County residents are not likely to have the resources to weather the fiscal impacts of the pandemic. This includes both below the poverty level, about 20%, and those that are assisted income and constraints. Households that are above the federal poverty level, basic cost of living, about 35% residents in Mendocino County. Mendocino County is also home to the large tribal population, approximately 6%, and Hispanic Latino population of 25%. Historically, inequities and language barriers present additional challenges to receiving timely and accessible aid. We are looking to partner with the Community Foundation to get money out to nonprofit partners for food banks, Meals on Wheels, senior centers, to reach those critical population for those that are in need of food at this time. And there's a list of partners, and you will see that next week. We are also working with HHSA on an emergency feeding program. This just came before me yesterday. I had a brief conversation with Director Tammy Moss-Chandler last evening, and we will be looking into these details. It is for restaurants to create meals up to 3 per day, and there's reimbursement through FEMA and the state for this. At this point, this project only goes through May 10th, so we will be working on it diligently the next couple of days to get this rolled out. That's the extent of my report for today.
All right, thank you, Deputy CEO Antle. Let's see, we're going to, oh, if you have submitted a public comment request to speak online, please call in now for item 5A. And I'm going to go to the board. I'm going to start with Supervisor Brown. Do you have any question for any of the speakers so far?
Yes, I do, Mr. Chair, and thank you. I have several. And this has to do with also the public comment that's been coming in. There was a question about the wearing of masks, and there is basic concern that children under 12 are not required to wear them, but there was no explanation going along with that. So I'd like to ask Dr. Duhan to comment, please.
Yes, thank you, Supervisor Brown. The language is that children between the ages of 2 and 12 are encouraged but not required to wear facial coverings in public. And the reason why I did that is because it can be difficult sometimes for parents to get their, let's say, 5-year-old child to keep a facial covering on in public. And we want to recognize that it might not always be possible. So it is, the language is something along the lines of encouraged but not required, or recommended but not required. And that is, again, in recognition that it can be hard sometimes to get kids to do these things. Children under 2 are not to wear facial coverings because of safety concerns. Thank you.
Thank you. And my next question has to do with recreation from a commenter. It's about our waterways with their comment that you can go to the beach, you can go to the Eel River, you can go to the Russian River, but do not get in the water. And the person making the comment would like a response to this.
Dr. Dewan here. I do not believe there's any restriction in my sheltering in place order that says you cannot get into the water. And I will also say that when we have limited reopening coming May 10th, I do anticipate that in alignment with the governor and the other counties across Northern California, the parks will be opening. So, but again, we need to collaborate with our parks and make sure that we're all in agreement, because the parks could decide to stay closed without, my having control over that. But I do anticipate opening of our recreational areas and parks for use with social distancing. Thank you.
Thank you. And then also this has to do with recreation. And it is a request that we open recreation, so in areas, boat ramps, etc., for salmon fishing, as fishing season will be open. Can you comment on that, please?
That would not be a restriction that I have put into place. That would be up to those who have control over the boat ramps.
Okay, thank you for clarifying that. Then also, a lot of email and public comment has come in regards to golf. And I've been trying to respond, but I may have been confused. Has the governor allowed golfing? Because the information I'm getting is it is open in Sacramento County. And I just want you to explain why we haven't looked at opening up golf courses here in this county if the governor's not restricting it.
There have been restrictions for golf across California, and there's been a debate about whether the governor's order allows or doesn't allow golf. I do anticipate golf opening up in the next sheltering in place orders on May 10th.
Okay, thank you. And then you addressed the older adults and suggested that they still shelter in place, even though there would be a limited reopening. But would we also like to caution all ages with health conditions to do the same?
Yes, in fact, that category does include all people with chronic medical conditions, in particular, conditions affecting the lungs, the heart, and that would include diabetes, because they're at high risk of serious complications and death from COVID-19.
But it could also include asthma and other types of health conditions.
Yes, lung conditions. Yes, that is correct.
Okay, thank you very much.
All right, thank you, Supervisor Brown. You kept it to 5 minutes, and that's a great role model for the rest of us. So, Supervisor McCowan.
Thank you, Mr. Chair. I would like to take a look at the model, not the methodology and the assumptions, but the results. So if I understood correctly, the model from Imperial College is if we did not have the shelter-in-place order, we would expect 1,800 cases in 2 months, 180 hospitalizations, 90 critical care, and 45 deaths. Was that accurate, Dr. Duhan?
The Imperial College modeling didn't look at the number of ICU cases, or didn't look at the number of hospitalizations, ICU cases, deaths. That part of the data comes from what we've been seeing across the country, that we see about 10% of people with COVID-19 being hospitalized and about half of those in the ICU, and then about half of those die when you have a surge. And it can be worse, actually, depending on the nature of the surge. What the Imperial College modeling looked at was the number of hospitalizations overall, and actually the number of cases, overall, and that if we have sheltering in place, how that would be limited. So what we've seen from the Imperial College work is that we've been extremely successful in flattening the curve. We've squashed the curve with what we've done in Mendocino County. So that has another side, that's a very positive side of the modeling, is how effective we've been with what we've done up to this point in squashing the curve.
Well, correct. Now, we heard estimates earlier, and they were a little different than this, and they were based, I believe, on what we could expect in a year. And it was described as a conservative estimate, 36,000 cases countywide, roughly 40% of the population. And then the percentages followed through from that, 10% hospitalizations, half of those, or 1,800, needing ICU, potentially 900 deaths. So, and again, that was described as a conservative estimate, but what were the underlying assumptions? Was that entirely without shelter in place, or could you describe that a little bit? And then it does seem like these more recent projections show a lower rate of illness over time.
I'm sorry for presenting it in that confusing way. The surge that would happen very quickly would not represent everyone in the county being infected. That would represent what would happen with a burst of new infections all at once. But that, if you look at what would happen once everybody in the county has been infected, that's where you get those higher numbers. So, like we've seen in New York, I'm trying to remember what the data was for New York, but I think they think that even in New York, where they had the horrible surges, I don't think they think that more than 15% of the population was infected in that big surge. So the number that you referred to, Supervisor, regarding those larger numbers, that's once we have everybody, let's say half of the people in the county infected. I'd have to look at those numbers again, but it's two different scenarios. One is what happens all at once very early on, and then the other is what happens over a year's time.
Well, correct, but the two are kind of related, and in either case, our current reality is far less than what the projections would have indicated, seems like.
Well, yeah, because we've effectively flattened the curve with sheltering in place. And we all know that we can't keep doing this indefinitely. So we know there's going to be a surge. And it's just the modeling looks at what will the surge be like, this big peak that happens all at once. What will it be like when you have limited reopening versus full reopening? And what I described is what the full reopening would look like.
Right. So one thing that intrigues me, because of course, we have the governor's order and the definition of essential businesses, and there are elements of subjectivity to that. But we do see that there's a lot of business activity is, still occurring. So we have, all of the grocery stores are open, the hardware stores, the drug stores, gas stations, banks, certain amount of construction. And as I go around, it's pretty obvious that the adherence to social distancing is very inconsistent. Even after your guidance on masks came out a few weeks ago, and then it was made an order, and compliance with that is still pretty inconsistent, including within places of business where the employees are required, and of course individuals are required, although there's maybe limited enforcement feasible against an individual, but businesses certainly should all have the memo that their employees need to be masked or have facial coverings. The point I'm getting at, despite the inconsistent adherence to social distancing protocols, we still have a very low rate of transmission or of infection. So, to me, that would be an argument in favor of allowing a broader range of retail businesses to reopen with the understanding they really do need to be practicing the social distancing. I think as we go further into this, the importance and the necessity for the social distancing measures, and masking is not per se social distancing, but it certainly complements it. But that's really where we need to be going as we reopen. Your response to that?
Well, Supervisor, my response is we don't know what baseline infection we have in our county because we haven't been able to do sufficient testing despite all of my advocacy to get testing in our county. But I do believe that whatever social distancing, whatever sheltering in place and facial coverings our people have done have been effective in slowing the spread. We have done an enormous amount to limit interaction. We've closed schools. I actually didn't close the schools, but the schools are closed. Governor closed the schools, as I recall. The superintendents closed them first. But anyway, we don't have church services. We don't have schools. We don't have restaurants. We don't have bars. There's many things we don't have. We don't have hairdressers. We don't have I mean, all these things we don't have at this time are limiting the spread. So we are surrounded by counties that have community transmission, Lake, Sonoma, and we don't have tourism. So as we have limited reopening, we will start to see community transmission. We will start to see more outbreaks. That is inevitable. And I think it's what's going to happen. I mean, I don't see there's any way to avoid it at this time, because we cannot continue to have people without the ability to participate in the activities of daily life that we need to be happy. It's just
Okay, thank you, Dr. Duhan.
Well, excuse me, Mr. Chair, I have one more attempt.
Well, let's
my point.
wrap it up.
Mr. Chair, please. So, and I agree with your comments, Dr. Duhan, at the end, but my point, and yes, we've limited many activities. My point is, we don't see a lot of cases resulting from all of these people in all of these activities. I mean, you go to the stores, the parking lots, very inconsistent social distancing, people standing in line for an hour without face masks to get into a hardware store. We're not seeing a lot of cases. So my point is, if we don't see cases from all of that with poor social distancing, what would be the risk of opening up the other retail businesses that are now considered non-essential? Logically, we would not see a huge surge from that, although at some point, surely we will get additional cases.
I have no further comment.
Okay, we're going to go on to Supervisor Jurdy then. Okay, Supervisor Jurdy.
Yes, hi. This is a question for Darcy Antle, if she's still in the conference room. And that has to do with the governor's announcement of a new program that sounds like it's still in the formation stages, but the governor announced using FEMA funds, some matching state funds, and then a requirement for some local funds. And I'm not clear on what the local match is. Perhaps Darcy could elaborate on that. She said the program at this point is only scheduled to run through May 10th. And but the program as it's announced is that seniors and people who are medically vulnerable can be enrolled in a program where they would then be able to purchase meals, up to 3 meals a day from local restaurants that offer healthy food. And we have many restaurants like that because we have so many locally owned restaurants in Mendocino County. And we're really lucky in that way. And it could be, I see it as both a lifeline to the medically vulnerable, the seniors, and also to the restaurants that are just hanging on with curbside and delivery. And so 2 questions to Darcy. When you said May 10th, is that because our current health order, shelter in place, ends on May 10th, or did the state program announce that would only run through May 10th? And can you just tell us a little bit more about the program as you understand it at this point, and how quickly could we act on it? Could this be on our agenda in next Tuesday?
Through the chair to Supervisor Jurdy, I'm going to put a quick call out in case Tammy Moss Chandler is on the line or can get on the line, but I'll answer what I can to your questions, Supervisor Jurdy. So it's the emergency feeding program to ensure Californians that are age 65 and over, or individuals that have been exposed to or contracted COVID-19 but do not require hospitalization or at a high risk of underlying conditions. The cost is limited at $66 per day for 3 meals. And they have a breakdown for each meal. And that's a 75% cost share from FEMA, 19% share on the state, and a 6% local share here. We would need to do a self-certification with those folks that fall into the categories. We would also have to have a background check to ensure the safety of the participants on those that are delivering the food, and a few other logistics that we would have to work out with the adult and aging team that's working on this. And again, that's Tammy Moss-Chandler's team through HHSA. So I don't know if Tammy has been able to get on. Maybe not.
Do you know if is the May 10th deadline? Is that in the state announcement, or is that because of our health order ending on May 10th?
No, that is through May 10th. So the way it reads is that the providing emergency feeding services through May 10th, unless the public health needs end sooner or an extension is granted by FEMA. So it's very similar. We would need to reach out to the state, would need to reach out to FEMA to get the approval on our behalf to extend that timeline.
Okay, thank you.
You're welcome.
All right. Thank you, Supervisor Jurdy. And Supervisor Williams.
Yeah, I will save the questions about reopening for item 6A, the reopening item, where we have more time to discuss. But Dr. Duhan, could you touch on how you see the testing capabilities ramping up? I think you stated that we need about 150 tests per week or 150 tests per day, and we're at about 30 tests per week. So we need to ramp up about 30 times the amount of testing we've been doing. Public has a lot of questions. We keep hearing about the need for more testing, and we understand that there's been a shortage of test kits, specifically the swabs, all the way from the federal government, from the CDC down. But what do you see as a realistic time frame? When will we have that additional testing capability? And second, in Covelo, where we've had recent cases, have you seen the sheltering in place successfully implemented?
So thank you for those questions. The Supervisor Williams, that it's actually 150 tests per day would be the goal. And I believe, I don't have the data in front of me, but I believe we've been doing on the order of more like 200 tests per week in our county. So, I mean, just yesterday we did nearly 200, and there's surveillance testing that's going to happen in Wallala today, which I think is about 60. So anyway, it's much more than 30 tests a week that are being done in our county, but the goal is 150 tests per day. There is a COVID-19 state of California testing task force, which is a private-public partnership. And this task force is working diligently to get increased testing capacity across California. I have to say that it's unclear to me exactly what they're planning. I was just on a call this morning at 8 a.m. with the state hearing about the plan. It definitely involves certain research institution lab hubs like UCSF, and we've seen UCSF actually has increased the capacity for testing in our county. The Wallala testing is going to go through the UCSF hub. But I have to say that it's unclear to me exactly how this is going to work for us in Mendocino County. We have seen increased testing capacity. For example, at Round Valley, they did get an Abbott machine, but this machine can't do more than 24 tests in a day, and those are only for symptomatic people. It's not meant for surveillance, and they only have, at this time, 48 cartridges left, so they can only do 48 more tests, and we don't know when they're going to get more. So there's limitations not only in the swabs needed to collect the samples for the PCR test, but also in the capacity of the machines to process the tests, the PCR machines. So there's limitations at every level. So I just can say that I'm looking to the state to bring the resources to us to increase our testing capacity, and I don't fully understand, because it's not been well articulated, what that would look like for Mendocino County. But we continue to advocate. Regarding sheltering in place at Round Valley Indian Reservation, I can only share what Chairman Russ has shared with us, and it's been in public forums involving the state, which is that there has not been strict sheltering in place taking place up on the reservation previously, but that there's been a great effort to increase that, and a lot of work being done on the tribal leadership's part to increase the adherence to sheltering in place now that there's been an outbreak.
Thank you. Supervisor Haschak, you're muted.
Thank you. Okay, Dr. Duhan, my question is about the testing. And since you've been advocating, CEO Angelo, the other supervisors, and myself have all been advocating at the state level for more testing for our county, do you think that there's a role for people to play in contacting their the legislative offices? Dr. Duhan.
I'm sorry, I just got a call from the state and I got distracted. Can you repeat the question? I'm so sorry.
Well, the question was, do you think that the people, the citizens and residents of Mendocino County should be advocating, since we're all doing it with, limited success at this point?
Yes, I do. I mean, I in response to Supervisor Williams, I can't say exactly what the resource is that's being provided to other counties, but I can tell you that there's something they're describing as Optum Serve, which are, I believe, specimen collection sites that will have facilitated testing capacity somehow. And Humboldt has gotten one, and Sonoma has gotten one, and there's going to be about 80 of these, as I understand, distributed around the state, and we need these resources. I wish I could say more about what it is, but the people of Mendocino County have been turning to me and, saying to me, you need to get more testing. And I think that it would help if they also raised this message up to this level of the state.
Okay, very good. I guess this is a question for CEO Angelo. Is about the Department Operations Center is now in effect, taking the place of the Emergency Operations Center. So will there still be a call center? And is that number still 234-6052 for people who have any questions about this?
Chair Haschak, first let me say that yes, we have a call center, and the number that you gave is still the number for the call center. I don't know how long we'll have the call center. We will have it as long as needed. We get approximately 400 calls a week, and when there are changes to either the shelter-in-place order or some other changes, usually our calls increase. So at this time, we had extended the time frame for the call center through this week, but the call center will be in effect until further notice. So that number is absolutely valid, and after hours, the call center does roll over to our dispatch number. Additionally, I would like to just say that we do have the warm line through our behavioral health department, and that is continuing as well. There is a difference between a departmental operations center and the emergency operations center. Initially, when this event started, this is a public health event, and our goal was to have Health and Human Services open a departmental operations center. Given the limited resources, instead of a DOC being open at Health and Human Services, we decided to move straight to an emergency operations center. And as you know, that EOC is in our complex. As it turned out, as time went by, and we realized that this event was not ending in 2 months, 4 months, maybe not even 6 months, we decided that we wanted to open a departmental operations center and support Health and Human Services with all the resources they needed to ramp up public health, to respond to C-19, and to build more resources within Health and Human Services along with the Emergency Operations Center. So currently, we have the Departmental Operations Center running out of Health and Human Services, and their number one responsibility is the actual public health response to C-19. And then we have the Emergency Operations Center, which is still running at a lower level, and the EOC's responsibility is to support the Departmental Operations Center and all things in response to C-19. And then, of course, we have the call center that remains open and will remain open to take calls as needed, along with behavioral health running the warm line. And I would also like to say, so we don't forget, that we still have an alternate care site that we have ramped up in case we need that alternate care site for additional isolation and quarantine. Thank you.
Right. And then one other question for Dr. Duhan is, you talked about the infection rate, and there's questions about whether infection rate leads to immunity. And so even if we have high infection rate, we might not have immunity at that point too. Is that your understanding, or?
This is an example of why slowing the spread and giving us time to prepare is so important. There are still a lot of questions about the degree of immunity that a person gets from having been infected, and we don't have those answers yet. I do think evidence that comes out of places like Wuhan, China, where they had an outbreak and now they're not seeing new outbreaks happening in the same city, is reassuring, because if they didn't have immunity, they would just keep having big surges. But that's an area of intense focus in research across the world. We don't have the answers.
Okay, thank you very much. We're going to open it up for public comment, and I'm going to go back to public expression when Mr. Gallo had wanted to speak, but he wasn't on the line when we took public expression. So I'm going to go to, if Mr. Gallo is on the line right now.
Yep, I am. Thank you very much. I apologize for not being able to speak earlier. I was having problems with the Zoom. Yes. So thank you very much for this opportunity.
Yeah. State your name, and you have 3 minutes. Sorry.
Okay, great. Thanks, no problem. My name is John Gallo. I grew up here on the coast. I left for college, got my PhD in geography in regional sustainability, and moved back here 5 years ago with my family. And we are living in extraordinary times. The goal of this 3-minute comment is to help Mendocino County become more self-reliant, more self-sustaining. I'm also making a specific request from the county that will help. So here are 4 facts that can be combined to create a scenario for the next year. 1, NIH official Anthony Fauci has repeatedly cited a timeline of 12 to 18 months for creating a vaccine. 2, we are also finding out that the virus is much worse than previous coronavirus behaviors. It attacks many organs, not just the lungs. In some cases, it's also attacking the kidneys, intestines, liver. Others, it's clotting the blood, causing heart attacks and strokes. And others, it's crossing the blood-brain barrier. This is old news to China and Italy, but it's new news here in the U.S., now reported last week in the Washington Post. 3, people that recover from the virus are getting it again, oftentimes worse. The Korean CDC is saying that of the people studied, it appears they are not getting reinfected by others, but rather that the virus seems to be reactivating. 4 is that the predictions are that the second wave in the winter is going to be much bigger than the current one. I'm going to skip this next part, talking about what this all can mean. Bottom line, what should we do now? We need to come together as one big team. We need to temporarily leave behind the old approach of relying on the politics of personal self-interest. We need to be Mendo strong. To pursue this, we should have a massive brainstorming event. If the county or someone can set up an online survey for ideas, that would be fantastic. I'd be happy to provide some suggestions for making this easy if you like. This will activate our countywide team of people. A key question could be, what can we do this summer to help us get through the winter? For one, we'll need to grow more food, lots more food. Let's find ways to reward people that increase their food production this year. How can we do this without costing county government money? Well, I have 2 ideas that the county could act on that I can detail in the survey or the next time I speak. Finally, one of the best ways to win 2 fights in a row is to avoid the first one. So the longer we can keep wise distancing in place, the better. I think I might even have finished early, so I got another 5 or 10 seconds. I just want to say I really appreciate all the time and energy everybody's putting into this and how everybody's taking it super seriously. Let's do this. Let's go. Thank you very much.
Thank you, Mr. Gallo. Okay, we have for item 5A, Brian Garay. Okay, not hearing from Mr. Garay. We'll go to Jessica Dubois.
Yeah, I'm here. Can you hear me?
Yes. Please state your name. 3 minutes.
My name is Jessica Dubois. I am a resident and local business owner in Willits. I've spent almost a decade in Willits building my business, and I take great pride in providing a needed service in our community. Despite the fact that my service was deemed non-essential on March 18th, my phone continues to ring off the hook with potential clients. In the past week, a local veterinary clinic has taken advantage of their essential business provision and now offers a secondary service of dog grooming. This action is enabled by our county's guidelines, allowing essential businesses to deem whether their secondary services are needed for their clients. The adverse effects this pandemic will have on mine and many other businesses in the community are unknown, but we should not have to account for others taking advantage of the loopholes in policy during this difficult time. I'm not here asking for my non-essential business to reopen before it's appropriate to ensure public safety. Instead, as someone who's invested their life in becoming a cornerstone of the community, I'm coming to you for help resolving the matter. I feel like it's more important than ever that our local government takes the proper steps to ensure that all business members and members of the community continue to have equal opportunity through this. I hope that you take this issue as seriously as I do and make an effort to resolve it as swiftly as possible. And I want to thank you guys for everything you've been doing for our county. It just seems that there needs to be a little clarification in the loophole so everybody's in the same boat.
Thank you, Ms. Dubois.
You're welcome. That was all I had to say.
All right. Okay, Rick Childs.
Hi, can you hear me?
Yes, Mr. Childs, go ahead. State your name.
Oh, wonderful.
3 minutes.
Okay, I'll start. Is Ms. Duhan listening also?
Yes, sir.
Okay, thanks, because this is mainly directed to her. I'm one of the many...
Directed to the chair here.
Okay. I'm one of the many people concerned with the devastating effects upon our social and economic fabric that these restrictions are creating. All the retail businesses that are teetering on the edge of going under, their employees losing their jobs forever is of very serious concern to me. And I would like to point out that I think there's an opportunity for Ms. Duhan to allow many of these businesses that right now are only essential, that are not considered essential by her definition, to be included. On page 11 of the California directive for what businesses are allowed to operate, it says other community-based operations and essential functions. And then it specifically identifies commercial retail stores and convenience stores that supply essential sectors. Essential sectors, and then it goes on to identify some of them, but it's not exclusive. It doesn't say these are the only ones. So it says basically essential sectors. And I think that's an opportunity for Ms. Duhan to allow many other businesses that we desperately need in the county to continue. She's allowed nurseries, marijuana dispensaries, liquor stores, but there's others that serve important constituencies of our economy and our community that have been excluded. And I can point out just a couple of them, but at the top of the list, businesses that should be included would be things such as Racine's, which is the only art supply store here on the coast. If that goes under, the hundreds of artists will be, unable to, continue their life. Another absolutely essential business is the bookstore in Mendocino, Gallery Bookstore.
30 seconds.
Anyway, so all these are essential for the quality of life businesses. They can certainly be reopened with all the health protocol that all the other essential businesses include, such as, limiting the number of customers, crowd distance, all those sorts of things, disinfecting. So allowing these essential for the future businesses should be included, and I hope she will do this as soon as possible, not wait till May 10th.
Time.
But allow this. Am I still speaking?
Well, it's time to wrap it up, Mr. Childs.
Okay. Anyway, that broad opening and the essential nature of we need these after COVID passes to be allowed to continue so that the quality of life and the community resources that they provide will still be available, and I hope she will do so. Thank you very much.
Thank you. All right, and Jennifer Seward.
Hello, can you hear me?
Yes. Yes.
I just to say that
you have 3 minutes.
I just want to say what a good job Dr. Doohan is doing and our incident commander as well. My concern circles around to the Redwood Empire Fair, which is scheduled the first week of August. And it does bring people in from different areas. And we obviously have as a main concern the health of the community of Mendocino County. And I will be sending Dr. Doohan an email asking a specific question as to what her thought is about the possibility of having the fair, seeing how the shelter in place is obviously a very flexible situation right now and will be changing. And with the fair, there will not be a way to do social distancing, but I am looking for some clarification on what her thoughts with that would be. Thank you very much for your time.
Thank you, Ms. Seward. Okay, so that's the end of public comment for now. And let's see, we will go to Tammy Moss Chandler, Director of Health and Human Services, is on the line, and she had an answer for Supervisor Jurdy's question. So is Ms. Moss Chandler on the line?
Yes, good morning. Thank you, Supervisor Haschek, members of the board. I appreciate the opportunity just to add to the information that Deputy CEO Darcy Antle provided today around the various efforts that we are doing to expand access to food and basic needs throughout the community. So to Supervisor Jurdy's specific question about the new announcement by Governor Newsom on Friday, April 24th, regarding this new program to really access and utilize restaurants to serve the senior community, we're actively working through our adult and aging services program to implement a plan that builds on what Darcy also mentioned around the efforts we've been working with already with our local community foundation, NCO, our Community Action Agency, and Adult and Aging Services, as well as our eligibility services for CalFresh to expand food access and coordination of long-term food security benefits throughout our community in partnership with various senior centers, in partnership with family resource centers, our food banks, our nonprofits in every area of Mendocino County. And we're really grateful to the Community Foundation. Your board will get a more detailed report about that next Tuesday on the work that we've been doing, and we're continuing to expand in partnership with our nonprofit community that provides food security in our community. So we're looking forward to expanding this new opportunity to work with restaurants in new ways. We're actively engaging in that plan development as we're we're meeting right now with my Deputy Director in Social Services, Adult and Aging Services, Kelsey Rivera, heading that planning up, and we'll get those details to your board and the public as quickly as possible. And certainly people who are interested in getting on a list for early information can call our Adult and Aging Services office as we begin to collect that. But we'll have a more detailed report to your board at next Tuesday's board meeting.
All right. Thank you very much for that update on that. And thank you, Supervisor Jurdy, for that question about that. I know I've gotten a lot of questions too. Okay, so I'm going to bring this back to the board. Is there a motion or action that we need to consider? Okay.
I have further questions, but I'd rather wait for 6A where we have more time scheduled.
Very good. Okay, so not hearing any. Thank you for those presentations, people, and we will take a break right now. Welcome back, everybody. So we're on to agenda item number 6A, which is discussion and possible action regarding economic recovery, including phases and timelines for relaxing COVID-19 restrictions on business activity in Mendocino County. The sponsors are Supervisors Williams, Supervisor McCowan, and Dr. Duhan. And so I'm going to start it off with Supervisor Williams.
Yeah, so this item is about delving into the specifics of reopening. The public at large has had a lot of questions about what will be opened and when. And before we start, hopefully to build unity across the board, I'd like to acknowledge the authority that these issues are not up to the board to decide. I've had a number of members of the public ask me, why did the board approve this, or why is the board allowing that? I think we should be clear, the Board of Supervisors does not have the authority to make these decisions. That authority under state law lies with the health officer. That said, I think there's opportunities for supervisors to relay local knowledge about what's working, what's not working, as we get into shifting from essential and non-essential to low risk and greater risk. That local knowledge holds a lot of value. We see where people are 2 feet apart without masks, what's not working. And we see other businesses that are ready to implement protocols to keep social distancing. And it'll be a shame if we've unnecessarily impacted the economy in ways that ultimately didn't benefit public health. So the thrust of this item is to have an open discussion to relay knowledge that we have from the public as supervisors covering 5 districts and the county at large, and get some guidance from our public health officer, because businesses and individuals will make better decisions about preserving their personal finances, their business revenue and finances, if they have a forecast of what may be to come. This is not 100%. We're not asking the public health officer to give us specific dates of when specific categories of business will reopen. Public health doesn't know. It's based on state policy, what the Bay Area counties decide, whether we see a surge in cases, so many variables that are unknown. But this prediction will be better than flying in the dark, which is where a lot of businesses are now, not knowing whether it's 2 weeks or 2 months. So I'd like to give Supervisor McCowan a chance to introduce the item, and then perhaps we could begin going through questions. I have a number of questions from the public I'd like to ask, get some guidance as to roughly which phase, approximately when, and with what sort of precautions.
Well, I'm going to go to Supervisor McCowan, but I'm also going to go to Dr. Duhan too. So Supervisor McCowan.
Thank you, Mr. Chair, and thank you, Supervisor Williams, for your comments. I agree with them. One correction, it isn't ultimately the public health officer, as stated previously. It is the governor as well. But certainly, I think decisions being made at the state level could benefit if they were more informed with the local knowledge of what we're experiencing here on the ground, it does seem like the governor is more finely attuned to conditions in the Bay Area, San Diego, Sacramento, Los Angeles. I'm not sure he really has his ear tuned in to rural California. So I think that's where this type of discussion can be helpful. And I also believe that Dr. Duhan's participation with the Rural Association of Northern California Health Officers can also be helpful, because I think their experience of what they see locally on the ground is probably going to be a lot more similar to ours than what we may see in the more urbanized areas. So, the one size fits all we so often see from the state generally doesn't fit rural California. All that said, we are dependent upon what the governor's orders are. However, it's certainly not too early to try and be informed about trends. And I do appreciate, Dr. Duhan, your comments on 5A, which kind of laid out a very broad, general rolling out of what reopening could look like. And perhaps through this discussion with the other supervisors and the public, we can go a little bit more into detail on some of those things. And although we don't have any certainty, I think we can indicate in a broad, general way what some of the phases and maybe guesstimated timelines might look like. One example, we had Jennifer Seward call in regarding the Redwood Empire Fair, which typically takes place in August. And I think recalling Senator McGuire's comments of a couple of meetings ago, it's really unlikely that we will see approval for large gatherings where social distancing is difficult or impossible to maintain, maybe for the balance of this year. And if those kinds of things are foreseeable, I think there's a public benefit to saying so now. So, maybe we can kind of get into some of those specifics as we go forward. Thank you.
Okay, Dr. Duhan.
Yes, thank you. I'm happy to have this agenda item and this opportunity to discuss this important topic in more depth today. I do think it's very important to make this a fruitful discussion, to continue to hold in the forefront what the health officer does and does not have authority to decide. So I'm glad that Supervisor McCowan just brought up the governor and the governor's restriction on gatherings. So when I'm asked what would I do about gatherings, for example, in a state fair, I have to say I have to wait for the governor because he has banned gatherings. So it's I think will make it most fruitful if we can really truly focus on what the health officer has authority on and then what I'm speculating about. And I opened up my comments today with speculation about what I thought might be coming in the next 3 months. But I do want to make clear that to the extent that I am able to, I am wanting to push forward limited reopening in a way that is safe. And that means focusing on being able to maintain social distancing, being able to limit transmission, and make sure that all of those beneficial activities in our county can continue, like our small businesses, which are the backbone of our county, should be able to continue. So I do also want to say that I really appreciate Mr. Gallo's comments about sustainability. Our lives are not going to be the same after this pandemic. It's historic, it's devastating, and we do need to focus on how we can change to adapt to these new times. Thank you.
All right, let's for board comment, let's go to Supervisor Jurdy. Would you like to say anything?
Well, I just want to bring to the public's attention that at our last meeting, we created an ad hoc committee of Supervisor Williams and myself through the chair because we both serve on the EDFC, Economic Development Finance Corporation Board, and non-voting members of the West Company Board. And we've, since that meeting, we've had meetings with a number of business sectors in the county, everything from restaurants that West Company organized and hosted. And they've already gathered the public initial input from those business sectors about how they would propose to operate in a safe way, and that information is in the process of being transmitted to the health officer for consideration for future health orders. So that work is underway, and we're going to hope to get more details to the health officer in the next couple of weeks. So I think that's mainly what I wanted to say on this agenda item at this point.
Okay, Supervisor Brown.
Thank you, Mr. Chair. I did talk or ask questions about the priorities of businesses and reopening, also recreation earlier. But my words are that we need to consider basically the impact on the economy and many of our small businesses, the loss of jobs. And when we come forward with a change or a soft reopening, we need to strike a reasonable balance. And I don't know whatever or however that's going to be done, but those are my words.
Okay, thank you. And I'll just say that Dr. Duhan is has been taking a lot of flack, I'd say, for the public health order for Mendocino County. But really, people need to realize that it is the state which is the real guiding public health order that we need to follow. And we do have a few variances from that, but not really that many. And what I'm hearing from people is certainly there's concern about small businesses, but there's also a large segment of our society or our county that's concerned about safety, about science, listening to the best medical opinions. And we can see what happens at the national level when politics and politicians get in the way of the science. It's a mess. And also, our county is blessed by tourism, and in these times we're kind of cursed by tourism. I've seen it. I lived in Ketchum, Sun Valley, Idaho for several years, and up there they had one of their highest rates of coronavirus because of the tourism factor. And then we see it in Lake Tahoe. We've seen it in Park City, Utah, and Mammoth Lakes, and that's because they have winter tourism. I'm afraid that what might happen here with the summer tourism is could be devastating. So I think that we really need to be cautious on what we do reopen. We do need to be cognizant of what's happening with the business community and try to make things, happen in the best way they can. But I understand that Dr. Duhan's hands are kind of tied by what happens at the state level, and hopefully those decisions at the state level will be guided, by good medical practice. Also, I'd like to say that as far as getting input from the community, I'd like to make sure that the Chamber of Commerce's are taken into consideration, and small businesses overall. I know the West Company is doing a good job at it, but I think we need to keep everyone in the loop. So that said, does anyone else have a comment, of the supervisors?
Mr. Chair?
Yes, Supervisor McCown.
Thank you. I would just add, and this is something that Dr. Duhan has stressed previously, and that Supervisor Jurdy referred to, having different business sectors propose social distancing protocols that they believe would allow their sectors to reopen safely. And in reviewing the public comment today, we see that a number of people and business sectors are picking up on that suggestion. I'm not sure I'm going to hit them all or try to, but we've heard from beauty salons, we've heard from yoga studios, the real estate industry, the golf courses. So I think we have many very conscientious people in our community, very concerned both about the health impacts of this pandemic, but also the economic impacts and the effect of normal living. A lot of people, and I think I do hear Dr. Duhan saying parks and golf courses, things like that, are likely to open up in the near term, but people touting the community and health benefits of those activities as opposed to being somewhat confined to their homes. So, you know, I really appreciate the individuals who are working to put together what safe protocols would look like for their industries. And hopefully there's a way that we can help push those ideas up to the state level as well, so there can be consideration given to all of the information that we see coming forward. Thank you.
Okay, thank you. Any other comment from the board right now?
Well, I'm ready to ask some questions of Dr. Duhan, if you would give me permission. And I think running through these questions, I realize with the video conferencing, the back and forth is a bit awkward, but I think it's the most expedient way to get a lot of the public questions answered.
Okay, go ahead.
So Dr. Duhan, the following questions are assuming distancing protocols, modifications to normal operating to accommodate COVID concerns. So I don't think we need to get into those precautions for each of the types of activities. But if you could give the public some guidance, I have about a dozen on the list. 4th of July, will 4th of July be canceled as far as gatherings?
I think we have to wait to see what the governor says about what size of gatherings will be allowed. And my sense, again, without knowing, is that we are not going to be going back to allowing large gatherings, but I don't know what the number will be. I made a guess when I made my opening statements of less than 18.
Understood. So the parade style public gatherings, those are off the table this year. And the reason I ask is so that the organizers can prepare to cancel.
Hard to imagine that the governor is going to allow those to occur.
County fair, I imagine the same.
Hard to imagine that would occur because also the tourism that's involved.
Right. Weddings with a cap of the 18 that you suggested earlier. I know it's not it's an approximation. Do you see?
It's a guess, but yeah. I would think that we were going to see events being live streamed with a small group together and then others participating from a distance, being a new model in these pandemic days.
Understood. I assume music events, concerts, and the like, sports events, those are all in the same category of approximately 18, some reasonable cap. Otherwise, it'll be by video.
I would doubt that we'll see contact sports occurring.
Wine tasting, is that classified as a bar? I know you've said bars probably not, at least for a few months, maybe through the year. Would that include wine tasting, for example, small tasting rooms along Highway 128 with ample outdoor space? Is there some leeway on those businesses bringing suggested protocols forward, or do you see that that's not likely to reopen no matter what the protocols are?
And I appreciate framing this, that we're assuming social distancing and we're assuming facial coverings and hand washing stations. But what we also have to keep in mind is transmission. So wine tasting, I see as a tourism activity. And in as much as you could do it without it being involving tourism, it seems that it could be done safely because you certainly could have social distancing. But my concern is that it is generally a tourism activity. I think that's my view of it. Maybe I'm wrong, but
would you think those businesses should prepare for not reopening this season?
I think in as much that they could open without it being related to tourism, I think it could be possible to have wine tasting as long as there was social distancing.
For example, taking bookings from county residents only, would that qualify?
It seems like that would make sense.
Restaurants, I know the governor has talked about half seating, removing half the tables.
Which seems like a very good idea. And I really liked hearing this idea of, helping restaurants move into a new space of doing deliveries and preparing food for people in other ways. But I certainly would want to see restaurants be able to open with the types of guidance the governor gave about. Certainly outdoor seating is a protective measure, and the spacing and not having shared condiments and so on.
What about lodging? I know you talked about potential modifications, doing a 14-day quarantine first before visitors get out and enjoy shopping and recreation. 14-day, I don't know how many visitors stay longer than 14 days. My guess is not many. A lot of people come here for a weekend or for a fraction of a week. Do you see lodging opening in the next 3 months?
For tourism?
Normal style bookings?
For tourism, then.
Yeah.
So, I mean, there was a very good comment that came in when I was doing an interview on KZYX from a person who lives in county but off the grid and says, she uses hotels to come to town, charge her phone, take a shower. I mean, I think that in as much as we can open up our businesses for people in the county and essential, we're going to move away from using terms like essential and non-essential work. But, we are aware that, for example, PG&E workers are staying in hotels. We need to keep them open for those functions. But in as much that we can continue to have lodging for the people in our county or extended stays, that seems like that it addresses that whole issue of concern about transmission.
So what I hear is a theme of we don't want to bring visitors. We don't want to focus on the tourist economy. The danger here is if we don't tell lodging, if we know lodging will not open this visitor season and we don't tell the industry, it'll be a worse outcome because they won't be preparing for what's to come. So I think the guidance you're giving is don't anticipate lodging opening for tourism this season.
And I appreciate the opportunity to share the work I do with Rancho, the Rural Association of Northern California Health Officers, where every conversation we have, this is the focus. What are we going to do about our northern rural communities where we don't seem to have widespread community transmission at this time, and we rely on tourism? So probably the single unifying theme across the rural counties. And generally, we're all really grappling with this very, very difficult issue and wanting to try and limit tourism as to the extent that we can while allowing our communities to survive this pandemic. So I think it's going to take some creativity on the part of the industry. I'm eager to hear from the industry. What do you suggest? Because of course, if they have a family come from the Bay Area and spread COVID in their whole hotel, they'll be down for another reason, which is everyone will be sick. So I'm sure they are just as concerned as we all are. So I'm eager to hear the solutions that come from the industry leaders in the lodging tourism industry.
But does that mean there's some leeway to open within the next 90 days for tourists?
As I said, the only thing I've been able to think of with my limited knowledge of tourism, being a family doctor and a health official, has been the idea that people could quarantine. But maybe there will be rapid testing by that time where people, I don't know what this landscape will look like, but you could imagine people being tested, and getting, if we have widespread testing, they'd be able to test and show that they don't have COVID and then be able to stay for an extended stay. It's hard to imagine people coming for 2 days from the Bay Area and then going back to the Bay Area again and that being safe.
Okay. Bookstores, I imagine bookstores will be considered retail, and retail is first phase with precautions. Is that right?
I would hope to see bookstores. In my first sheltering in place order, I wanted to see quality of life businesses stay open, art stores, craft stores, bookstores. And I definitely would like to see those open as well with social distancing protocols.
Personal services, I'm thinking hair, nails, massage, the types of personal services where precautions can be taken, masks can be worn, but there is, by the nature of the service, less distancing. Are those potential for phase one if proposals are brought to you, or do we need to wait?
That particular area, I think, is very controversial. I want to see what the governor does. I think that, again, with my just imagining how it might be possible without knowing what the governor will do, I'm thinking that having something like a much more limited number of clients coming in, so you don't have multiple people in the salon at the same time, and you can do temperature checks, temperature checks are not great because we know now that people can be infectious but not symptomatic for 48 hours before they develop symptoms, but at least it would limit the spread. So I think we need to wait on that one.
Okay. Church gatherings?
Well, again, this will be determined by the gathering size that the governor approves. So I don't know, but I do believe there is going to be the allowance for gatherings of some size. And I believe that what will happen is we'll see an expansion of the live streaming that we started, where I said it needed to be limited to 4 people. We've already, the churches have already, the faith-based organizations have already been doing that, which I really appreciate. And I'm hoping that those gatherings will be able to be bigger. And you would want to keep in mind that those frail elders would be very risky for them to come. And so I hope that in those settings, there would be an effort to really make those experiences, those faith experiences, meaningful to those who do still need to shelter in place and stay home because of their age and potentially their frail health.
You mentioned schools earlier, schools reopening and services for children, trying to mitigate the effects on the next generation. I understand that schools are not closed because of the county health order today. Do you see schools opening before the next school year?
All of the conversation that I'm hearing is that we want to see children, activities for children resume. This is based on the fact that children do not seem to be seriously affected overall by COVID, although we know that they could be reservoirs, if we want to just use that public health term, to infect elders. So we still want to make sure, this is why we have the social distancing and the sheltering in place for people over 65 to the extent possible, likely to continue. But we do want to see, universally across the board with all the conversations that I have, governor level, Abajo, Rancho, we want to see children's activities resume. What we're talking about is stable groups. There's stable groups of 10, stable groups of 12. In other words, you'd have children of a certain cohort, group size, with perhaps 1 or 2 teachers, and they stay together long term. It's kind of think of that old-fashioned schoolhouse model of teaching. And we already are seeing that in the current orders with childcare, that it's a stable group of 12. So I think we will see summer camps, activities for children opening up in that way with stable group size and a limited number of teachers.
If a school were to bring forward a proposal today to limit to that 10 or 12 with staggered times.
I'm sorry, I missed the beginning of your statement.
If a school were to bring to you today a proposal with limiting of 10 or 12 that stay together and staggered times, is the door open to consider the proposal?
I think we have to wait for the governor because it was the governor, as I recall, who closed the schools.
Right. Camps. Are you thinking only day camps for locals, or does this include sleepaway for out-of-town guests?
Well, I think sleepaway for out-of-town guests, again, you'd be in this situation where you would be worried about transmission. If it was a small camp and it was just 12 kids and 1 counselor, you would take the risk that you would have an outbreak, but it would be mitigated by that small pod. More and more, I think we're thinking about, pods, pods of a bigger size, but then if you have an outbreak, it's contained within that pod. That's the thinking.
Fishing is open now. It's food production. It's never been against the state or county orders. But practically for the small fishermen who need launch ramps, they're effectively closed. I know salmon season opens on the 1st. Would it be appropriate, given that this is not against our orders, to have the county maybe through a letter clarify that those ramps can in fact be open, whether the fishing is commercial or for personal use? It's not prohibited today.
I would like to see that happen. What is prohibited is tourism style fishing, where people are going on I'm sorry, I don't know the exact term, but it's a fishing boat where people come.
Sport fishing,
perhaps. Party boats.
Party boat.
As part of a tourism, which we love to see that occurring, but we are focusing on allowing fishing for food.
Okay,
that should be able to occur.
And then my last item is real estate. And it's been equated to folks can go to drive over to Ukiah and go to Walmart where it's packed, no social distancing. But a real estate agent showing a house that's been empty for a day or two to one potential buyer has been seen as a risk. Is that likely to change in phase 1?
I think real estate is going to be opening up. It is. We do allow real estate now to show houses. It's with some limitations, and I would lift up the realtors came forward with guidance that I thought was really helpful as an industry. They came forward with that guidance, and I used that guidance to allow for real estate in my last sheltering in place order, or to allow some loosening of restrictions. So I think real estate is going to be allowed in a more fully or less restricted way in the next governor's orders.
I appreciate that. And then to wrap up, what do you see as the time range to return to full normal? Maybe it won't be exactly what we had before COVID, but whatever our new normal is that 3 months out? Is that a year out? What's your best guess based on the science and what you're hearing from partners throughout the state?
I'm very sad to say that what I'm hearing across the board is a year to 18 months before we're seeing life going back to normal in our world, in our country, in our state.
That being the case, one of the arguments, and this is more for perhaps the incident commander, Carmel Angelo, one of the problems that we're seeing across the county is we have local residents trying their best to follow the orders to a T in most cases. And they look out their window and they see visitors coming in, either coming here to shop or visitors wanting to get into recreation, thinking that they're shut down, it's vacation. And it's we have this double standard going on where, due to lack of enforcement, it's the locals that are suffering and giving up their normalcy while they're watching visitors get to enjoy it. What is our plan for enforcement? I would think either we back off on some of the regulation, or we decide it's necessary and we actually enforce it. But this in between isn't setting well for a lot of people. And then that was my last question. Chair Haschek, thank you for letting me go beyond my 5 minutes.
Okay, thank you for those clarifying questions. That really, I think it helps to have Dr. Duhan's opinion about this. And we'll go to CEO Angela. Did you have a comment about Supervisor Williams' last question?
Chair Haschek, thank you very much. And Supervisor Williams, thank you for that question. I think code enforcement is the one area in this whole process around C-19 that is the most challenging. And you bring up a very good point. Code enforcement, the board, the sheriff, our code enforcement officers have done everything they can to put a system in place or a process in place that could assist county staff with code enforcement. So I would say that maybe this should be a larger discussion at the board level and possibly with our partners. When you talk about code enforcement and you're asking me to weigh in, my response is that this needs to go back to the board, because we have Sheriff Matt Kendall, and we certainly have Trent Taylor, and then we also have John Martyr with the Special Investigations Unit. All three of those departments are involved in code enforcement. And there is a good percentage of calls that come into the call center regarding code enforcement. When you talk about seeing visitors in some of the parks, some of the areas around the coast, we don't even know that that's county property. Some of it is state property. So, this is a big issue. The public doesn't understand, and we could understand why. But maybe there should be a larger discussion at the level of the board around code enforcement if we're going to continue with shelter-in-place orders. At this point, I believe that the sheriff is doing everything he can to support enforcement. I certainly know that Trent Taylor is. So, short of going onto property that's not county property and having no authority, there's really not much more that we can do. And every complaint that goes into the call center is referred to code enforcement as appropriate. So thank you.
For clarification,
Thank you.
CEO Angelo, are you telling us that the county enforcement, our law enforcement, cannot enforce our public health order on state lands? Because if we start down that path, it means we can't enforce at the beach, at state parks, on trails. Can we enforce on private property? What about federal property?
So through Chair Hashtag to Supervisor Williams, I most likely am not the best person to answer that, but I think you asked some very good questions, and I would either refer to our chief counsel, or I would ask that we invite Trent Taylor on the call. If Sheriff Kendall is still on the call, maybe he could answer that. I don't want to give out wrong information, but I am concerned that possibly there are areas that we cannot impact that may be involved in some of the questions that you're bringing up. So I don't know if Chief Counsel Christian Curtis would like to respond. Chair Hashtag, is that okay if he does?
Yeah.
Thank you.
County Counsel.
Thank you, Mr. Chair. Just a few things. First of all, I did want to remind the board that this board did in fact pass an ordinance to authorize code enforcement to be able to enforce the local health officer orders. I do want the board to be aware that that's only suitable. So that created a significant amount of additional resources that could be put on the enforcement front, but it doesn't make it suitable in terms of the mechanism for all types of enforcement. The notice period, the opportunity to abate means that an individual who's only sort of temporarily in the county might be more appropriately served by law enforcement enforcement mechanisms rather than through code enforcement. In terms of the issues as to how the various law enforcement agencies are enforcing with the tourists, and I would just note as an aside, one challenge that we may have may be that those people that are coming here from other jurisdictions, there's sort of a self-selection issue in that those are the ones who may already have decided that they're going to be violating the orders of the state and are coming here to do that. So in terms of the disparity between local compliance versus potential compliance from out-of-towners, I think there's going to be just a little bit of an issue in that front in terms of what the numbers are going to look like. I would suggest that we would probably want to have an item come back to the board. I don't know all of the issues that have been arising on the enforcement front. I have had some conversations with code enforcement and with the sheriff's office, and I know that there's been some coordination among the various jurisdictions. But I would actually suggest that it would be best to have code enforcement and the sheriff's office speaking to the challenges that they're seeing and the areas where this board may be able to help or may be able to develop strategies in terms of tackling those issues.
Hey, thank you, County Counsel. And I'm going to go over to Sheriff Kendall.
Yes, I'm on the line.
Add to that?
Well, when it comes to, can you hear me?
Yes.
Okay, this is Matt Kendall. When it comes to enforcement on state property and whatnot, and a lot of it, we're talking about state parks, state beaches, things like that. What the sheriff's office has done is we have deferred to state parks to deal with their portion of it in the same fashion that we've deferred to Fort Bragg Police Department or Ukiah Police Department to deal with their portion of it inside of their area of jurisdiction. Now, so far, code enforcement has been dealing with businesses while the sheriff's office, our task forces, along with SIU, have been dealing with persons in this. There have been a lot of complaints that when we investigated them, we found that, they are not as reported. There have been several complaints that came in, a person is doing this, and then someone puts it on Facebook, and then 3 days later, even after we've gone out and dealt with it and gave a little education, it stopped. 3 days later, somebody puts it on Facebook because they heard third hand. And then we've suddenly got all these calls coming up for the exact same thing that we've already dealt with. And that's one of the reasons why we're dealing with these things kind of in our own jurisdictions. State Parks is dealing with things, we're dealing with things, code enforcement, as well as all the other, all of the cities. One of the reasons why it's so important that we get that feedback through the call center is because they track those calls and we don't wind up doubling up efforts on something that's already been taken care of.
Okay, thank you, Sheriff Kendall. All right, with that, we're going to...
Chair?
Yes, Supervisor Brown.
Thank you so much. And just hearing all this conversation, the questions, responses, I'm thinking that we need to be looking at fines for violators when we think about code enforcement. Don't know when that should be coming up, but also I heard Dr. Doohan talk about perhaps hairdressers, barbers being able to go in to an individual's home. And then also talking about restaurants with limited opening, their preparation of food, etc. I think that not only businesses should be consulted when we think of all of that, but also regulators like Environmental Health, who does a lot of those inspections. Don't know about the state and what inspections they're doing right now. But I think we do need input also from regulators, so to speak.
Okay, thank you, Supervisor. We're going to
Mr. Chair.
Oh, Supervisor Jurdy.
Just briefly, our meetings are an opportunity for Dr. Doohan and others to get information out to the public. And one point of change in the most recent health order was to allow for retail businesses that are not deemed essential to be able to make sales over the phone or the internet and have delivery. So maybe if Dr. Doohan could just explain that. And a lot of people are asking, at what point would they also be able to have curbside pickup rather than expecting the employee to drive to their home? So maybe you could just explain that a little bit, because I think there's a little bit of confusion in the public about that change that took place in the latest health order.
Yeah, thank you, Supervisor Jurdy. That was not actually a change. It already had said delivery was possible for your existing inventory. We just created an FAQ that restated that in the terms that you could have it include delivery by an employee. So it wasn't actually a change. It was there all along. We just added an FAQ to clarify an employee could deliver it. In as much as a business wouldn't be allowed to open, and I hope that the kinds of small businesses that you're referring to would be allowed to open, I think curbside pickup would be reasonable. So I would hope that we would have both curbside pickup and more opening of the small businesses.
And then finally, can you explain the difference between curbside pickup versus delivery as to why under the current order is curbside pickup not deemed to be safe, but delivery is?
Yeah, so thank you. It has to do with our concerns about restrictions at the level of the governor, because the governor's original order is about essential and non-essential businesses. And when you have a non-essential business, and then curbside pickup, I think we were concerned that this would cross the lines with the governor's order and might lead to problems with enforcement. And I'm glad we're having the discussion about enforcement, because in as much as I'm concerned about protecting the public, I'm also concerned about protecting our workers that are involved in enforcement. We don't want our public safety to be put in positions that are impossible for them or extremely stressful for them because it's hard to enforce something. So this curbside pickup came into that category where we were worried that it would both be hard to enforce and that it might also infringe on the governor's orders around essential businesses. But I think that we'll see an opening in the limited reopening. I think we'll see some room to allow for these businesses to resume in safe ways, including curbside pickup, in which case it would no longer be an enforcement issue.
All right, and I'm going to go to County Council right now.
Thank you, Mr. Chair. I just wanted to reiterate what Dr. Duhan had said, that was coming from concerns regarding compliance with the governor's orders. In fact, her initial order had specifically allowed curbside pickup or similar methods, the one that actually came out before the governor's order, for various retail establishments that provided certain quality of life items. Including it under minimum business operations created some concerns. We are hopeful that with the next round of clarifications and changes from the governor, that's something that will be looked at.
Okay, thank you. And Supervisor McCowan, did you have a comment?
Yes, thank you, Mr. Chair. I might have a few comments, but one thing that I thought might be helpful, since we're talking quite a bit about the governor's order, and naturally we cannot be more restrictive than the governor, perhaps either County Council or Dr. Duhan could briefly state the specific differences in our order as opposed to the governor's order. I'd appreciate that if, Mr. Chair, if you'd be willing to ask that question.
This is Dr. Duhan. Without advance notice of that, I do not have that information at the top of my head, but I do believe, and I'd like to refer to County Council, I do believe at one point we prepared a document such as that for my benefit to help me guide my decision-making. And I believe that may be available to share, but I don't have that information at the top of my head.
Okay, County Council, do you have that information? Is this something you could go over very quickly?
I don't know. So I could give really just a very sort of general summary at this point. I will say that I believe the document that Dr. Duhan is referring to was several orders ago. So it's actually something I'm not certain if it would still be entirely accurate at this point. In terms of just the overall differences, there's actually been quite a few changes that have been made to the local health officer's order to try and bring it in line with the governor's order. So there were areas that there were changes, for example, that the quality of life items had been cut out where that had been previously allowed under the local health officer orders. A lot of the specifics have to do with areas really where the governor's orders either lacked definition. So, for example, there's not a lot of discussion in terms of non-work related essential activities in the governor's orders. There was sort of a lot more explanation and definition that had to be provided at the local level on that, because people really needed, as I understand, there had been a lot of questions that had come in. People really needed a lot of clarity on that front. The other sort of big one I would note is that the tourism industry in particular and the vacation rentals in particular were an area where there had been a lot of sort of uncertainty and ambiguity in applying the governor's order. And that was one area that given the risk posed by had been alluded to previously, the risk of infection created by tourism, and also the nature of our own local economy. Dr. Duhan had spent some time trying to make sure that there was sufficient definition on those to really allow that to be enforceable and to have some certainty for those businesses.
Thank you. Is that it, Supervisor McCowan?
Well, on that last point, so we have, particularly with tourism, and is this specific to lodging or tourism in general, we've provided what County Council calls sufficient definition, but I think that may imply greater restrictions or clarifying that we have certain hard restrictions in place. Is that accurate?
If I may, Mr. Chair.
Yes.
Yes, that is accurate, and thank you for the question, Supervisor McCowan. Yes, when I talked about tourism, it was specifically transient lodging, lodging for people coming from outside of the area for a short period of time. Particularly, there had been some sort of hard limits placed on the vacation home rentals that were there specifically for enforcement purposes in terms of concerns as to both ambiguity in the governor's order, but also sort of how do you verify when you have as diffuse of a base of rentals that there's actually compliance with requirements as to which purposes are allowed, essential versus non-essential, et cetera.
Okay.
Thank you. And one more on that point. Does that mean if we are somewhat more restrictive on lodging than the governor, does that mean our local health officer may have more leeway to create exceptions for extended stays? We've heard if people are staying for 14 days or longer, perhaps that's a lower risk transmission. Is that something that could be implemented at the local level if it was thought warranted without having to wait for the governor?
So if I could just respond, Mr. Chair.
Yes.
So that one in particular, I don't know that there would be an ability to authorize. Some of the challenges have to do not so much with sort of the general idea of what is allowed and what is not allowed. And the general idea that tourism is not allowed, I think is relatively straightforward and clear from the governor's order. The issue has more to do with specific things that were put in place to allow for enforcement and to provide some clarity in terms of sort of how to the extent that the businesses are allowed to continue to operate. The idea is that they're supposed to be operating for the purposes of providing, was referenced before, PG&E workers, or there are some people that had long-term housing needs that they meet through hotels or other transient lodging. There was a desire to make sure that if we're getting new essential workers in the area, whether that's healthcare, whether that's first responders, whatever that is going to be, that they have the ability to obtain housing on a temporary basis and continue to operate. The areas where the definition was applied and where there were sort of more specifics had to do with things like the short-term housing. The short-term rental of vacation houses, there was concern that would simply be, if that was allowed to operate for essential purposes, there was a concern that would be simply too hard to verify and too hard to enforce. There was, and I'll be candid at this moment, I don't remember if it was in the order, if it was in the guidance, but there was there was a concern that had been raised, for example, about hotels or other transient lodging requiring people to say, just sign a form or check a box saying that they were there for essential purposes to allow it to sort of proceed with sort of a wink and a nod. And so there was a desire to make sure that there was more definition and more clarity that would allow the spirit and the substance of both the governor's orders and the local orders to actually be something that could be applied and enforced in a meaningful manner.
Okay, thank you.
Thank you. Mr. Chair, I actually do have a number of other points I'd like to raise.
Well, let's see.
You allowed our colleague, Supervisor Williams, to ask every question that he had. I would like the same courtesy if you would.
If I may jump in and just say, this is Dr. Dewan. I do have a call with the state about the outbreak at Round Valley that I need to get off of this meeting. I apologize. At 5 p.m.
Okay. Supervisor McCowan, can you do it in a couple questions, please?
Again, Mr. Chair, you allowed Supervisor Williams to ask every question he had. I won't ask more than I think I need to, but I'd appreciate the same courtesy. And Dr. Duhan, one thing that I would like to ask you about, because I think the risk of contracting the disease is a function of a number of things. So it's obviously proximity to someone who may have the disease, but I believe, based on comments I've heard, it's also a function of duration. So when we had the case identified in Ukiah recently, the prison inmate, part of the concern, what exposure may he have given to other people in the community? And if I recall, part of the discussion was that he, upon questioning, said that he had not been within 6 feet of anyone for as long as 10 minutes. So is that accurate, that it's not simply being within the 6 foot distancing, but the duration of time that you're within that proximity also is an important factor in determining risk of transmission? Is that accurate?
Well, it depends on the setting, of course. If you're a healthcare worker in a hospital with somebody who got COVID-19, it's a different type of scenario than if you are out in general public. But in general, when we define close contact in the general public, it is within 6 feet for more than 10 minutes.
Thank you very much. And I do think that supports the direction that I believe we're going in allowing a lot of our small businesses to reopen, because I think most of them at this point are very aware of appropriate protocols and very willing to enforce them. And so, even though you're within 6 feet, obviously, anytime you're at a cashier station, you're only there typically for a couple of minutes. So I would like to see if I've got a couple of these things right. And, we've had a long discussion here, and including on the previous item. So just to recap briefly, it does sound like, depending on the governor, we're likely to see a reopening for golf courses, for bookstores. Would that be for retail in general, do you think, such as clothing stores, whether it's a shop on Main Street or a big box?
Well, clothing stores are particularly problematic because of the high touch surfaces of the clothing when you try them on. So I'm not sure what's going to happen with clothing stores where you might have the ability to try them on. Because we know that the COVID virus lasts for up to 72 hours on surfaces.
Correct, which is why we should be washing our hands frequently and thoroughly. There could be hand sanitizer available coming into the store, going out. There could be a prohibition on trying clothes on. You can buy it, didn't fit, bring it back, that type of thing. So clothing might still be problematic, but most retail in general, you would foresee that is likely to open with appropriate social distancing?
Well, saying most retail is a pretty broad category. I don't know that I can say most retail, but I would think that there would be opportunities for retail businesses to open. And again, we should be hearing from the governor in the next couple of days, and I'm sure that will guide the decision making going forward. But I think.
Thank you. One more on real estate. And, and thank you for your previous order did, create more opportunity. But one thing that is still currently not allowed, I think, is the direct showing, particularly if the property is still occupied. So we did receive quite a bit of information from the industry on ways that they believe a house, even one that's occupied, could safely be shown. So perhaps the resident is not there, proper social distancing, cleaning of any touched surfaces, wearing shoe coverings and masks, etc. Is that something that we can control simply within our local order, or does that also require more action by the governor?
I believe in my current order, everything you said is allowed in the order already. But the question about opening up real estate with less restriction would require the governor.
Right, but so the governor doesn't currently allow an occupied residence to be shown or to be shown directly?
Mr. Chair,
I believe the current order allows an occupied residence to be shown already.
Okay, well, thank you. That's wonderful. And again, I won't.
County Council.
County Council.
I'm sorry. If I could I just want to clarify. I think you. I believe that Supervisor McCowan and Dr. Duhan may be talking about slightly different parts of the order. With respect to a residential property, I do believe that there's a requirement in terms of in-person showings, limiting the viewing of a residence based on a certain period of vacancy. In terms of the question of whether there might be room to loosen that and still be in compliance with the governor's order, I will just say to the board, I don't know the answer to that off the top of my head. That's one of the things that I would have to take a little bit of a look at. As I recall, the real estate definitions or the handling of real estate in the governor's order was particularly ambiguous. So that's an area that we'd have to do a little bit more research and investigation. And my apologies for interrupting.
Thank you. With regard to the parks, and of course, our local order allows for parks to open if the owners of the parks choose to open them. So I guess that speaks for itself. I wanted to ask about, we are hearing again from business sectors, particularly we've heard from yoga studios, hair and nail salons, and I do understand that's an area of concern given that people are working directly, yoga studios, I think they've shown they can do social distancing. Health clubs and gyms could institute social distancing by not allowing certain activities. The hair and nail salons, barbers, more problematic. Certainly a social value as well as an economic value to allowing them to come back. So I think it's pretty well understood they would not be in the first round, but I certainly hope we can give serious consideration to their recommendations, and hopefully they would be at least in the next round with appropriate social distancing. And so the final question, and thank you for your indulgence, Mr. Chair, but Dr. Duhan, could you describe a little bit phasing in terms of duration of time between orders and how many orders you may foresee both the governor and yourself coming out with in terms of a phased reopening? What's that likely to look like in terms of phases and duration over time, if you're able to, kind of guesstimate that?
Yeah. So first of all, let me say about social distancing is when we talk about 6 feet of social distancing, we're talking about somebody who is not breathing deeply and heavily because they're exercising. So, we do have concerns when somebody might be exercising. This is a respiratory virus that's spread by respiratory droplets. And so just to keep in mind that the distancing that might be okay when standing in line in the store might not be okay if you're in an exercise facility indoors. Regarding the orders, I am not going to do another sheltering in place order or revision before May, let's say 8th, May 8th to 10th. I've said May 10th, but it could be as soon as May 8th. But I will not do another sheltering in order revision before May 8th. Because right now I need to focus all of my attention on the Covelo outbreak and any other outbreaks that might come up in the coming week. Regarding what sheltering in place revisions might come after that, I don't expect it would be sooner than a month after the next sheltering in place revision, because it's going to take time to see how that impacts the community. And my expectation would be that one would have to see whether there was an increase in hospitalizations, increase in outbreaks, if there was the introduction of a widespread community transmission. And if those things happened, then, or didn't happen, that would then guide the next phase of consideration of reopening. So I would anticipate somewhere between May 8th and May 10th, the next sheltering in place order, and then sometime in the beginning of June, the next.
All right. Well, thank you. And let's see, I think we had a lot of questions there. So I'm going to open it up to public comment.
Chair Haschak, I had one really quick follow-up.
I'm going to public comment. We've had enough. Okay, so Jennifer Seward, are you on the line?
I am on the line and I have no comment at this time.
Oh, okay, thank you. Okay, we're going to go back to the board. Is there a motion or any action for this item? Supervisor, any?
Well, Mr. Chair, so the action was actually, or the item was kind of two-part. It was also to allow a discussion of what economic recovery would look like. So we obviously have had quite a discussion about reopening specific businesses and business sectors. We haven't really had discussion yet on economic recovery and what direction we may choose to give there.
Okay, anyone else?
This is Supervisor Jordy. I would just remind the board that we have the draft report prepared by West Company, and that would make a good agenda item for our next meeting with West Company present. And I think that is a part of the discussion that Supervisor McCowan's requesting, which is about the economic recovery.
Okay. All right. Seeing no other comments, we're going to move on to agenda item 5.
Excuse me, Mr. Chair. I actually do have comments. My first comment was to point out that there was more to this item than what we had discussed thus far. So because you're in such a hurry to move along, I'll only raise one point. And that is the board had previously given, well, I'll preface it by saying, obviously, we are in a radically changed environment from when we adopted our budget. We know that based on the pandemic, we have been spending quite a bit of money beyond what we anticipated, only a portion of which we're likely to recover. We know that our revenue is going to take a sharp downturn based on the decrease in economic activity, and our discretionary revenue is based almost entirely on local economic activity, sales tax, TOT, et cetera. So we're going to see a shortfall in revenue, an increase in expenses, and the time to start thinking about how we deal with that is now. And one item that the board previously approved was that we would have more effective enforcement of people who are not complying with our cannabis ordinances. And so without going into the issue of cannabis and what's legal and what's not legal, we did previously give direction for staff to come back, I believe, with a proposal for the board to adopt that would allow for aerial surveillance as a much more efficient method of tracking compliance, be able to send out letters to people that are perceived to be in violation. And we know that in Humboldt County, this has resulted in significant recovery of revenue and limiting of non-compliant activity. So I don't know if, excuse me, I don't, Mr. Chair, please.
For item 6A, it's dealing with the COVID-19 restrictions on business activity. And so we're off
Mr. Chair, the item is also economic recovery, and I'd like a report on where we stand in terms of staff bringing that item forward.
Supervisor McCowan, I believe that you're out of line. Okay, thank you.
Point of order, Mr. Chair, discussion and possible action regarding economic recovery. That's part of the agenda item.
It's dealing with the COVID-19, and that's what we've been trying to do in all of these. This is a
well, Mr. Chair, I will defer to you, but as a co-sponsor of the item, you're completely wrong, and I resent your continued cutting off of anybody because you perceive you have the power.
Well, thank you. All right. I appreciate you not proceeding on that. Okay.
Chair, I also have a question.
Yes, Supervisor Williams.
We've been breaking at about lunchtime for the last 4 meetings, and I'm getting a lot of feedback from the public that the public sees we have both a health crisis and an economic crisis. They want to see what we're going to do about it. And I brought this item forward, sponsored by Supervisor McCowan, asked for 2 hours to get a block of time so that we could begin looking at how we're going to dig ourselves out of this hole. And if we break again at lunch and we say we don't have anything more to discuss, let's end the meeting before and give up the afternoon session. The message it sends to the public is we're not serious about doing everything we can do to dig ourselves out of this hole. There's a number of remaining issues. Enforcement. If you're sitting at home or if you're in Ukiah at the admin center, you see the order and you think we're limiting visitors. You look out my window and you'll notice there's motorcycle clubs going by. There's 3 cars parked at a state park with out-of-town license plates. There's a huge gap between what's in the order and what's actually happening. And the longer that persists, the more residents will decide to not follow it. The effectiveness is eroded if people see it only applies to the honest residents who are following it to a T and not to the visitors. We need to talk about the enforcement issue. So if you don't want to do it here, that's fine. But I would like to hear what is the follow-up plan? When do we plan to allocate sufficient time at a meeting to address the people's concerns? And you're muted.
No, I'm not muted. Well, I don't know. We've talked about this for over an hour.
It was a 2 hour.
There's a lot of unknowns right now with waiting for the governor's order to be revised. And so I think that, we've heard what the public health officer has to say. We're waiting for any kind of revision that we have to abide by from the state. And so So I think that we have this ad hoc that's working with small business recovery. If you want to discuss it more, we can do that.
So, Chair,
when we go off topic, it's not serving our purpose, and it's not abiding by the Brown Act.
So Chair, my request is we ask County Council if it would be appropriate, I think it would, that we go into our closed session items at lunchtime as planned, but continue this item, which I think is fairly broadly worded. And after our closed session at lunchtime, when we go back into open session, by then we should have given advance notice for Trent Taylor, the sheriff, et cetera, to get back onto this agenda item to explain in greater detail how they're implementing the enforcement, because I think that discussion could take place as part of this agenda item, but it would benefit with their participation in the afternoon.
Okay, County Council, is that appropriate?
Thank you, Mr. Chair. So I do believe that as to the, it may actually be technically moving back a little bit to 5A rather than 6A, but in terms of the enforcement discussion, I think that would be appropriate as long as I don't want to speak for code enforcement or for the sheriff's office in terms of their preparedness to go forward on those questions, but in terms of just the Brown Act issue and whether you could tackle enforcement as part of this item, I do think that would be appropriate. I would say in code enforcement specific to the health officer's orders and to COVID-related issues, I would have a little bit of concern about going too much into detail on discussion of cannabis-related enforcement issues.
Okay, thank you, County Council. So we can bring this back. We can continue it on after lunch. We have a closed session at lunch, and we still have 5B and 5C to do. But at this point, with Dr. Doohan having her state call, it's probably a good time to break right now. We'll come back and continue on with 6A. But during lunch, we are going to have to sign out. The supervisors are going to have to sign out because we have a closed session, and we will be dealing with items 8A, 9A, and 9B.
Mr. Chair?
Yes.
I would just like for the public to know when we'll be back in session. Thank you.
We are planning on being back in session at 1:30. Thank you. All right, is that clear, everyone? So right now we're going to sign out. We're going to come back in the afternoon at 1:30 and deal with 6A, 5B, and 5C. Okay, so everyone needs to sign out and then come back to the other closed session. And when you come back at 1:30, it will be the same Zoom conference. Okay. And I'd just like to say that with item 6A, we will continue that, but I have been trying to move things along because we are in a crisis. We have, our CEO, our public health officer, really trying to make calls to the state and juggle those and dealing with a lot of things with the Round Valley issue. And so I feel like I'm trying to move things along as quickly as possible. We do have a budget hearing next week on May 5th. And so a lot of these issues about the budget finances will be explored in depth then. And so with that, I would say, we do have Rule 19, which says, each supervisor has 5 minutes. And you have 2 shots at the, 2 bites of the apple. And so unless the supervisors want to waive that rule, I would like to adhere to it so we can use our time as effectively as possible. So with that, if no one wants to waive the rule,
I would ask to waive the rule. This is the most important business we have. The public is watching in great numbers, wondering what steps will we take to save the local economy and to protect their health. And we've week after week cut these discussions very short. And I think there are some pressing issues to discuss. We're trying to dig ourselves out of a hole, but we're not digging as hard as we need to. So with all due respect, I don't want to drag this out, but I also don't want to have a hard time limit that's arbitrary. For example, 2 questions or 5 minutes.
Well, it was 2 times of 5 minutes each. But if there's others, if we have a majority that wants to waive the rule, we can certainly do that.
I would support waiving the rule for the reasons stated by Supervisor Williams.
All right. Supervisor Jurdy?
Yeah, I think for this discussion, I would waive the rule, yes.
Okay. And Supervisor Brown?
I agree. Thank you.
Okay. Then we will continue on with our discussion of item 6A. So we'll start with Supervisor Brown.
I'll pass for right now.
Okay, Supervisor McCowan.
Thank you, Mr. Chair. And I appreciate Dr. Doohan's comments that in the next order, we're going to be moving away from what I think many of us recognize as the arbitrary, or at least somewhat arbitrary, distinction between essential and non-essential businesses, and moving more towards can businesses operate safely. And that also seems to be very subjective. And one of my concerns currently, we do have people at the state level that are making these decisions. They don't necessarily have detailed information about how many of our businesses actually operate and the safety measures they may already follow. And one example, I would come back to barbers, cosmetologists. These folks are board certified by the state. I think they have 1,600 hours of training that's required. They operate under stringent guidelines for sanitation. And we have received proposals from a number of individuals in this industry. And I would like to see us find a way to try and push some of this information up, higher up, to the governor's office so they can start considering the facts of how these businesses operate, and I believe can operate safely. To say that we will come out with another health order on May 8th, and the next one won't come out until June, that'll be too late for many, many businesses. We already know businesses have closed, more will close. Obviously, we all want to protect the public health, but I think there's a great deal of awareness of how to do that. And I will go back to my earlier comments that we see businesses that are designated essential operating, few restrictions, very inconsistent compliance with social distancing. You only have to take a brief drive through any shopping center or hardware store parking lot. It's obvious what I'm talking about. They're not observing the social distancing. We've got businesses that are clamoring to open and willing to put strong restrictions on themselves. I'd like to see us, again, find a way to try and advance the interest of these small businesses. Also, part of the purpose of this item was to try and come up with some guidance to individual business sectors. When are they likely to be able to reopen or not? And I think we've made some success there, but and also the conditions under which they would open. But we have to understand this is absolutely critical to our local economy. Estimates a couple of weeks ago, it'll be 5 years to recover from this. I think it'll be more like 10. the further we continue to suppress our economy beyond what is necessary to protect health, the bigger a hole that we're going to be in. Thank you.
Okay, Supervisor Jurdy.
Well, I do appreciate the revisions to the health order that the health officer made, and but we all know that there are issues that are at the face of it sort of inconsistent, and part of that is because of the state health order. An example of that was, Kohl's in Ukiah on their website says that they are available for curbside pickup. To my knowledge, the county has not fined Kohl's, and yet we have small businesses, locally owned businesses in Mendocino County that allegedly have been fined for curbside pickup. I received an email today from someone who was upset, and again, I haven't had chance to verify this, but that a small business on the coast was fined for curbside pickup. And so I hope that's not true. But the point is that our health order, because it is conservatively towing the line with the state order, on this point, even though there's no apparent safety issue there with curbside pickup, we're penalizing the small business and not, as far as I know, prosecuting, enforcing the order on the big business. And so I think we need to that's why we do need a discussion with code enforcement, because if we're not going to enforce the order with the big businesses, why are we putting these details and expecting enforcement for the small businesses? So I think that's an issue. Another issue that Supervisor McCowan just brought up, the hardware stores are open as they should be, but they also sell home goods. But if you were to go to a store in Fort Bragg, Willits, or Ukiah that sells home small appliances, like a blender or something like that, it's shut down because it's not deemed an essential business. And they can't even currently have curbside pickup. And I just think that's not right. Furniture stores as well. I mean, these are sort of backbone businesses. These are not businesses that are attracting tourists to our community. They're here to serve local residents. I think we just need to be thinking through every aspect of the health orders as they're drafted to intentionally allow as much as we can that is not creating a health hazard. And I do hope that we have the sheriff and also Trent Taylor online, because that was a request late this morning that they be on to explain the code enforcement process and to answer these questions about how code enforcement is working. Do they need more tools to prosecute the large business that might be violating the rules?
Right. And Sheriff Kendall and Trent Taylor from Code Enforcement are on the line. So welcome. They can answer your questions.
Which one of you do you want to go first? You want me to go first or Trent?
Sherry, you go ahead, Sheriff.
Wait,
okay.
Mr. Chair, I'm sorry. Strictly speaking, I think the enforcement is more appropriate as part of 5A. I would just suggest noting going back to 5A for the benefit of the record.
I have a question about that. So this item was about reopening the economy. What we hear is the quickest path to reopening the economy is compliance with the health order. The reason we're discussing enforcement and compliance is so that we can recover. So I would tie it with 6A.
County Council?
I still think it's more appropriate as 5A. It's simply my suggestion is to state that we're going back to 5A.
Okay, so we will go back to 5A in this discussion, and we'll go to Trent Taylor with Code Enforcement.
Hi, it's Trent Taylor, Mendocino County Planning and Building Code Enforcement Division. Can you all hear me?
Yeah.
Yes.
Okay, so I'm trying to follow the question that Mr. Jurdy posed, and as far as enforcement on businesses go, we respond to any complaints we have about that. We've been very successful in getting compliance with the health order. If an obscure question comes up about how a business is operating, I relay that through county council, ultimately to the health officer, and get a determination. We've had 100% compliance of those businesses that we've responded to by way of complaint.
I guess my follow-up is either code enforcement or the sheriff's office aware of a business being fined for curbside pickup? And if they are they aware if whether Kohl's was also subject to the same fine?
I can answer that. Trent Taylor, Planning and Building Code Enforcement. Since the urgency ordinance for making this a regulatory violation was passed, we've handled all business complaints in the county. Code enforcement has, not the sheriff, and that not a single business has been fined. We have stopped a number of businesses that were doing curbside pickup that were non-essential businesses. I have not got a complaint on Kohl's, and I don't have any knowledge of what's happening at Kohl's. It's actually in the city of Ukiah, and that would not be in our jurisdiction to enforce from code enforcement. The city of Ukiah would handle that.
Okay, and my understanding is that to date, there haven't been any fines that the county has levied.
That's correct.
Okay. Hey, Sheriff Kendall, do you have anything to add to that?
Well, with the work that the sheriff's office is doing, everybody needs to understand that the civil notice of violation, we have to find someone that we believe to be in violation. When it comes to that civil notice, we have to warn them on it and then give them 24 hours. They can be fined after that 24 hours. We haven't had people who are continuing to violate an order after 24 hours. As a matter of fact, almost everybody that we run into immediately comes into compliance. As far as stopping vehicles and whatnot, the license plate frame on a car is not probable cause for stop. It simply isn't. And we can't get into those weeds of we're going to stop someone because they don't look like they belong here. The fact of the matter is we've got to have probable cause for stop. We have to have probable cause for contact. And if we don't, then we're going to be violating people's rights. The compliance in itself has been good. I spoke with some motorcyclists on Highway 20 this weekend that I'm certain everybody was saying they were not locals. Well, I believe that they actually were. They were riding over Highway 20. I stopped and spoke with them. They said they were maintaining their social distancing as they were on motorcycles and they were heading home. Just a couple of other issues. When it comes to state parks and whatnot, I've been trying to get a hold of Lauren Rex regarding this, but we've got to allow them to be able to police their jurisdictions in the same fashion that we allow Fort Bragg Police Department and the Ukiah Police Department to police theirs.
All right, Supervisor Jurdy, do you have any other questions?
I appreciate clarification, and I think it's helpful for both the code enforcement and for the sheriff to explain that nobody has been issued a fine, because obviously if I'm getting an email alleging that was the case, then others are probably reading something along those lines on social media. So I'm glad that they were able to clarify that for the record. Thank you.
Right. Supervisor Williams.
Yeah, if it's all right, I'd like to share a couple photos. Is that all right with you, Chair?
Go ahead.
So are you able to see this?
Yeah.
Supervisor Williams,
yes.
If you could explain what the photos are.
Yeah, so these are some photos these are photos that have come in just today. And there's, I don't know, dozens more, maybe hundreds more that I've been receiving. If you look through these, they're all out-of-state plates. This one's New Mexico. I think I saw Colorado in there. You drive Virginia, campers, RVs, these are all over town. So I understand the logistics problem of it's not probable cause. The sheriff can't approach and say, what are you doing here? But the code enforcement can't address it. Parks isn't addressing it. The bottom line is we have a large influx of visitors. And what we're hearing from public health is the quicker we can comply with the order, the sooner we can reopen our economy. I don't want to tell the local art store that they can't sell pens and paper, but Walmart can. I mean, they look at me like, well, if we could see each other face to face, they would roll their eyes and ask, how is it any different risk? You're supporting a big box store with corporate ownership from out of town, but you're putting the small family business under. And what we're hearing is we need to comply with the order so that we can get them reopened sooner. what is the step forward to compliance? Because if we tell the public there's nothing we can do about it, we're not going to have people continuing to follow an order when they see visitors disregarding. These people from Virginia, from Colorado, from Oregon, from New Mexico, they've driven more than 20 miles. If they're in the town of Mendocino, they've broken the health order, which says you can drive 20 miles from your home to recreate. They've driven all the way across our county, perhaps across our state. So I don't know if the question is for the EOC, for Carmel, for law enforcement, but we need to have an answer.
Can you unshare your screen? Thanks. So Trent Taylor, do you have any idea about how to deal with that? Or Sheriff Kendall? You've already addressed it.
Can you hear me?
Yes.
So here's some other questions that go with that. Were they here prior to the order being in place? Were they in Mendocino County? Do they own a home here? Something like that. The investigation that we have to go through, if we investigate it and we find that they are not in compliance, then they're given that warning. Will they be in compliance in 24 hours?
Understand the logistics concern, and I know that some of them may be folks who bought a car out of state and they brought it back and they haven't gotten California plates yet. If it were a few, we could brush it off as, we don't have a good sense. But when you see dozens of them and you hear stories about people are walking in their backyard, they run into folks from Oakland and they ask, what are you doing here? And the answer is, well, we're sheltering in place. And so, we decided to go recreate in Mendocino. There's so many of these stories. It's become prevalent. The order is kind of becoming a joke that locals are following it and visitors ignore it. What do we do?
Can you hear me?
Yeah,
sure.
Well, what we can do is we can make consensual contacts with folks like that, as long as we aren't throwing a traffic stop on them. But you have to understand it is a consensual contact at that point because we're not turning on the red lights. I don't know how far a detention would hold up on this, but we can ask questions of them. We can, move them along. The fact of the matter is, if we can get a little bit of a toehold in that, we might be able to push. The intent is the biggest portion of the violation of this law. You have to intend to break the law. We have to know, have they been given a copy of the health orders, the most recent health orders? Do they understand it completely?
Is it possible for us to put up signs at our entrances? 128, 20, 101, no visitor services.
I thought that was discussed previously with Caltrans and the Highway Patrol.
Caltrans said we can't use their signs. They're saving those for an emergency. And of course, I pushed back and asked, what is this then that we're dealing with? But that's fine. We can't use their signs. Could we use our own signs to try to get people to turn around? If they know their visitor services are shut down, the beach is closed, they may turn around 90 minutes before they get to the beach. Nobody wants to do that long drive to find that there's nothing at the other end. My worry is we have a public that feels their civil liberties are being infringed. They can't go walk on a beach. They can't walk on trails they're accustomed to. And I know that if we push on state parks to open the beaches and open the trails, we're going to get flooded with visitors and that'll be shut down. I'm trying to find a way for us to open those up, but not bring in thousands of visitors from out of town. And if we can't do it today, I don't know how we're going to do it in phase one.
I understand that. Perhaps we can speak with Howard DeShiel regarding that. The state highways belong to the state. I don't know how they would feel about the county putting up signage on their highways. Howard would probably have a better answer towards that. But as far as people feeling like their rights are being violated, I understand that. We live in a country that's based on freedoms. But I'm not going to go out and start contacting people because they don't look like they are where they should be.
Yeah, and don't take this as me. Don't take this as me complaining about the sheriff's office. In no way. But if the answer is we don't have the authority, only the state can do it. Only the state can put those signs up. Perhaps the supervisors need to be working with state reps to get the signs up, because this is a state order. We're trying to follow state direction, and what's unique here is we're a visitor town, at least the coast, and we're not going to, we have as many visitors coming in on a monthly basis as we have a population on the coast. We're not going to be able to convince the health officer to lift these regulations to support business unless we come up with a way to mitigate visitors showing up in droves. And if that means we have to reach out and work with state partners, let's do it.
Right. Any other questions, Supervisor Williams?
The only other question I had was for Dr. Duhan about whether routine dental will open in phase 1. A lot of people have been holding off on dental work. I understand only emergency services are allowed. And I also understand it's a fairly significant risk with the aerosolization, but I imagine it needs to happen. If we could get confirmation, it would be appreciated.
Yes, my understanding is that there is a return to planning to have routine medical and dental services being endorsed by the governor. Can you hear me?
Yes.
Oh, okay. And so I do expect that there's going to be a return to routine dental services. One of the things that I want to reflect on that was said earlier by Supervisor McCowan is about how we can practice social distancing, and in certain businesses, even if we come closer, like let's just say hairdressers and not even talk about dentists. But one of the things we need to do is realize that the mask that is worn to prevent respiratory secretions from being passed from one person to another should be a medical isolation mask. And those are in very short supply. So the facial coverings that we're having the public wear to supplement their social distancing are not thought to be protective if you're closer than 6 feet and doing something like cutting someone's hair. So I would think that the limited surgical isolation masks that we have would be reserved for dentists before they would go to, for example, someone who's cutting your hair. So that would be one of my concerns about the difference between close contact work like routine dental work versus hair cutting.
All right, Supervisor Williams.
Yeah, one last question for Dr. Duhan. A small private school has asked about the possibility of reopening. If they're able to structure staggered times and no more than the 10 to 12 together at any time, should they bring that proposal forward? And I guess in the abstract, we've been putting out through the ad hoc to the business community, bring your proposals forward. What form would you like those to be in? Is it a plot plan, a description of best practices, how they're going to clean, how to stay distance? Is there a template that you would suggest so that the information coming to you is in the best form?
So we, the health officers, been asking the governor to create a standardized form because every county is doing this repeatedly in their own way, and it's very inefficient. But it doesn't seem like that's going to be coming soon enough. So I would just ask for it to be presented in some type of organized way. It will come to me and county council, and we'll review it together. And I'd like to have it, early next week so that we can be working on it in preparation for May 10th. Regarding schools, my understanding is the governor closed schools, and until the governor says that schools can reopen, then we can't reopen schools. But what was just described sounds like an ideal situation for a school to reopen, which would be called exactly that: small classroom sizes, staggered, and especially, kids who are sick should stay home and teachers who are sick should stay home, which I know that in our pre-pandemic days, none of us were necessarily that good at staying home when we were sick.
That's all the questions I have for Dr. Duhan. Dr. Duhan, I appreciate you sticking around for this. Supervisors, I would like for us to decide on next steps for the enforcement and the signage problem related to visitors. And if you want to ask me to go work on that and bring it back next week, I'd be happy to. I would like a consensus on how to move forward.
If I could add about the signage on the highway, I've been in contact with Caltrans, and according to the Caltrans office out of Eureka, which covers our area, District 1, the signs that you see, those informational signs that are dispersed throughout the state, they have a schedule for the entire state of California that's about 7 days out. Some signs are up for 24 hours, 48 hours. And so advised me that they cannot make unique signs for Mendocino County. They did include in a recent list signs that was on previous weekend, like a Friday, Saturday, beaches closed, stay home. So they are aware of the issue of visitors leaving their hometown to visit beaches and state parks. And they do seem to be timing that, at least in that weekend, for a weekend drivers. But to my knowledge, they're not allowed to, District 1 said anyway, they're not allowed to have unique signs just for Mendocino County.
All right, and I have let's see, CEO Angelo would like to comment on that question that Supervisors.
Thank you, Chair Hashak. It sounds like there's an echo here. I hope you can hear me okay. I just wanted to say that our Department of Transportation Director, Howard Dashiell, is calling in. If you wanted to have a 5-minute discussion about the signage on the highways, Howard may be able to add to that. In response to Supervisor Williams' question about enforcement and the CEO's role, the only thing I could add is that even if we added another dozen code enforcement officers or deputies, based on what our sheriff is saying, I'm not certain that we could still get to the root of the issue that has been brought up. Certainly, if this board would like to increase our number of code enforcement officers, if Trent Taylor was even willing to put more code enforcement officers out into the community to actually police the areas, I'm not certain that there is anything else that we could do at this point. Certainly, our chief counsel has been working on this and will continue to do so, and I could confer with him after this. But as far as your CEO or incident commander with C-19, I'm not certain that there is anything else we can do with code enforcement with the public health orders, or that our issues aren't any different than the other 57 counties. We can increase our staffing. We could have people do a walking patrol. I'm not certain what else we can do. And then I think we still run into the same issues that Sheriff Kendall brought up. Thank you. And I think Howard is on now, Chair Hashak, if you would like to invite him into the discussion.
Okay, Howard Dashiell, Director of Transportation.
Yes, good afternoon, Chair, ladies and gentlemen of the board. Can you hear me?
Yes.
Okay. I got to turn my computer off. It's reading over here. There, now it's just me. So what Caltrans did say is that they would give us a permit to put a sign in the state highway. And when this came up, I think the ideal place to put that big sign would be right over the top of the welcome signs that the county already erected, that say wine, waves, and wilderness. They've already on compliant mounting posts. They've already got, one of them's on private property, the other one is permitted. And we would simply make a sign with a really simple message in really big letters that was really easy to read, to say what you want to say, like Mendocino County closed to guests, no services, something real brief like that. Someone could help come up with that. But I think the best place to do that would be right over the welcome signs.
And where are those located?
Well, there's one on Highway 101, at the south end. And there's one on Highway 20, over on the east end. And the traffic counts indicate that the majority of the traffic enters our county, either 101 or 20. I guess we could put something on the Humboldt line. I don't think we have a welcome sign on the Humboldt line, but we could. There is a place right where the Redwood Run gate is that is visible from the highway that we wouldn't need a permit because it's actually county right of way. So, if you wanted me to put a sign at those points, I guess the other one that wouldn't be covered then would be Highway 1, but probably you could do something in Gualala to handle that?
Probably 128 would be of issue.
That's true. That's true.
Well, I think the idea is to put something that just says no tourist services.
Yeah.
Well, I could do 3 signs really quickly as far as the 2 welcome signs and the sign up on the Humboldt County line. 128 and Highway 1 would take longer. It would mean installing posts and getting the permit for it. I mean, not that you couldn't do that, but it would just take longer. You would get the bulk of your traffic just at the 2 welcome signs, in my opinion.
Okay, very good. Supervisor Williams, anything else?
Yeah, I would support that so long as we could add Highway 1 and 128 to the list. It may be just where I'm sitting. I'm trying to shelter, so I've left my house to go to 3 fire calls and help the sheriff unload masks since the night of March 10th. I'm trying to follow this because if I don't, how do I expect other people to? So I'm not seeing the rest of the county, but I see a state park out my window and I get photos from the coast. And we have a problem. We have visitors in large numbers. And we have vacation rentals that are still operating despite our attempts to enforce the rules. So I think the signs are a logical next step and I would support it, especially if we're looking at this continuing through the summer.
Okay. Any other comment about that? I agree. So, all right. So Supervisor Brown, any other comments about this?
Not the subject we're on right now but I think it's a very good idea to have the signage. And I think it's very important. We talk about visitors. Santa Cruz County, at least this is the information I've received, is they have opened their county parks, which could include beaches. But what they've done is a time frame, early morning to like 6 a.m. to 9 a.m. and later in the evening, like 6 p.m. to 9 p.m. so that they don't get these visitors coming in to make use of what only the locals are allowed to use during this crisis and shelter in place. So I thought that was a really good idea. But I'm once again going to go back to what I talked about earlier, and that is including regulators, good business practices. Because as Supervisor McCowan talked about in the last meeting, I spoke about barbers and hairdressers. They are highly regulated, and they have certain protocol that they do have to follow. If they go into someone's home to do that service, they may not have the ability to do what they're supposed to do under state regulations. But I also worry about some of our restaurants and their preparation of food and what inspections are going on now to make sure it's being properly done. And they have their distancing when cooking, so to speak. So I do have a lot of worries. I want to see business opened because we just need to have a spurt in our economy. People are suffering, small businesses, people without jobs, but we need to strike a reasonable balance in order to do so. Thank you.
Okay, Supervisor McCowan.
Thank you, Mr. Chair. I don't have anything specific on enforcement, but I have other comments on a different topic when you're ready.
Go ahead.
Thank you, Mr. Chair. So we were hopeful that we were going to hear more from the governor yesterday. I think there were indications he was going to lay out a 4-point plan for reopening. That didn't occur yesterday. I don't know if there's been any developments today. But if you don't mind, I'd like to hear from either Dr. Doohan or CEO Angelo if they have any more information on the direction that they believe the governor may be going, if they've been able to gain any kind of preliminary or draft information either from our state associations or from the health officers.
Dr. Doohan.
All of us are waiting daily to have guidance from the governor, and there's no information that I have about what the governor is planning other than it's going to be a staged, limited reopening based on certain criteria regarding hospitalizations and surge.
All right, and CEO Angelo, do you have anything to add to that?
Chair Hashtag, thank you. The governor spoke at noon. I'm not sure what he said. I'm actually contacting CSAC now to ask them if there was any additional information that has come out either today or over the last couple days that they could share with us. And if I get that information, I will share it with this board. I'm sending an email now, but I don't know of anything further on the 4-point plan. Thank you.
All right, Supervisor McCowan.
Well, thank you, Mr. Chair. When we get down to next steps, I might have a couple of suggestions on perhaps what we might ask the health officer to do if she's comfortable, and what we might ask CEO Angelo and our ad hoc of Supervisor Jurdy and Williams to do.
Well, do you want to just go for it now?
Well, thank you, Mr. Chair. So one thing, again, I mentioned earlier that I have a concern, I think many people do, that the governor is more finely attuned to more urbanized areas. He's potentially not really hearing a lot from rural California. And honestly, many things are similar between Mendocino County and the rural counties to the north and the Bay Area, but many things are not. And, you know, we don't have the same level of concentration of, density of people. I think that to some degree has probably helped us keep our rates of transmission low. But I really appreciate the shift to safe practices more than, trying to define essential versus non-essential. So I would hope that our health officer, if she's comfortable with it, working through the Rancho Association of the northern counties, the Association of Bay Area Health Officers, the state calls that you may be on, that CEO Angelo may be on. CEO Angelo, your work with California State Association of Counties, I would hope that we would be actively advocating for the governor to, again, provided that operations can be conducted in accordance with social distancing, so we're reasonably confident there's a low level of transmission. Let's try and get more businesses back in business sooner rather than later, because frankly, the overall community health is directly related to our economic health as well. So I think one of my colleagues called earlier for hopefully some more balance. So I'm hoping that we can raise our voices in hopes that some of these concerns might be reflected in the governor's future orders. And along that same line, I would appreciate it if the board would perhaps give authority to our ad hoc of Supervisors Jurdy and Williams to also advocate according to their judgment of what they think is appropriate. So let's start raising these issues as broadly as we can would be my suggestion. Thank you.
Right, Supervisor Jurdy.
Oh, I appreciate Supervisor McCallan's suggestion, and I just wanted to make sure the board was aware one more time that the early draft recommendations and comments, feedback from the different business sectors is in draft form from West Company, and I'm hoping that by end of business tomorrow that they could be distributed to the whole board for review for an agenda item at our following meeting, and that they could also be forwarded by end of business day tomorrow to the health officer as she begins to think about, and I know she's already been thinking about the next order in early May.
Supervisor Williams.
I agree with everything said. I have nothing more.
Okay, and I'd just like to add that, you know, it is one of those situations we're in where we all want business to come back. We want the small business owners to survive. And yet we're in this conundrum of waiting for the, you know, governor to change the order. And at the same time, I feel like, you know, working on these best practices is a good idea. Safe practices is necessary. But I don't want to put undue political influence on the public health officer. I want the public health officer to do what's really best, you know, as far as the health and well-being of our county. And so it's a fine line, it's a balance, and I don't want to end up like Louisiana or South Dakota or any of those places. So anyway, those are my comments.
Chair Haschek.
Supervisor Williams.
I back those comments, and I think we have to be careful that we're not trying to weigh the economy versus health. I see those as on the same side of the scale, because if we open too fast with too much, we may have a caseload that forces us to shut down with a longer and more pronounced shutdown. And so I support what you're saying. It's in the specifics that it starts to break down. When we tell a family-owned business that they can't sell colored markers, but Walmart can, that's a problem. The public asks, why is there not a risk at Walmart, but there's a risk at this small store? I don't have a good answer. And so somehow we need to go case by case, almost store by store, and look at how the risk compares to other risks that we're allowing. And it may be that initially we had to act fast and we shut everything down. That was the right move. But if we continue with that pattern, these businesses won't recover. And these are family businesses. These people live in our communities. They're our neighbors. They're going to go under while we've propped up Costco, Walmart, and the like. Nothing against those businesses, but that really shouldn't be our focus. We should be looking after the small businesses of Mendocino County.
Right. I agree with those points. So any other comments on this? All right. Well, hearing none, we have some action that we've done. We've given direction to Howard DeShiel, the Department of Transportation. You know, I think the ad hoc committee will continue their work, and we will wait for the governor's revisions to the order, and hopefully those will come out tomorrow. And we'll continue on with that. Are there any other comments? Okay, hearing none, we will move on.